Good morning, Wolford Health Centre. How can I help?
It could kill you. Yeah. Or paralyse you, stuck in a bed at a young age. There's a viral bug that's causing a bit of sickness, a bit of vomiting.
But yesterday, someone told me if you're puking up, you could have stomach cancer.
I could hardly hear anything yesterday.
But you're not having difficulty hearing me?
No, no.
And if I lower my voice, you can still hear me?
So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore.
I need to bring your arms slowly forwards.
Oh, ow, that's cute.
Good morning.
Hi, all right. Filled out all the forms and stuff.
We're all good to go. Hopefully you won't be sick, but welcome to the practice.
Thanks for your help. Cheers.
Right, thank you. Bye-bye. OK, hello, everybody. All right, you have a seat. How are you doing?
My chest is quite bad.
Right, OK.
I had a scan on Friday.
Yes.
And the baby's fine.
Yes. That's
No
good,
worries
isn't
at the
it?
moment, yeah.
Yeah. So how long's the chest been a problem for?
Over the weekend.
OK.
I don't know why. I don't know if it's changing weather or changing hormones. I don't know.
Yeah, and tell me a bit about it.
Just struggling to breathe.
OK, so sort of tight.
Yeah.
Yeah.
Can we come off of there, please?
And remind me, you're asthmatic, yeah?
Yeah.
And you take 2 different inhalers, yeah?
Yeah.
Have you haven't
Sorry.
had that many of them, actually, have you?
No, I had spare ones at home, but
Yeah.
I haven't. I'm just on my last one.
OK. What do you think's going on? Tommy, I'm going to give you something to do, all right? Can you do a drawing for me, OK?
Sorry.
It's all right. So let's just see what your temperature's like. That's normal. Is the pen not very good? What you have to do is you have to hold the pen so it's like that, OK? Do you want one too? Yes? Okie dokie. You're good at drawing. OK, there you go. OK, so let's have a listen at the back first, just to breathe. Oh, that's fantastic. Oh, you've written your name. Wow. Can you do that again? You are quite wheezy, actually. Let's see what you get on this. $300. So that's a bit down.
Hopefully I can be fairly brief.
Oh, well.
In 2012, I came to the surgery
Yeah.
to talk about jock itch, because I was getting itchy.
Right.
So he gave me some Dactacort or
Yeah.
something. And it's never really gone away, 5 years later. And then, obviously, a lot of it's out of sight. And I took a photograph of my buttock about 3 days ago, and
Yeah.
I thought, well, actually, I need to try and do something about it. I presume that's all part of the same
Probably.
thing.
Yeah. Can I have a little look today? Is that
Yeah.
right? Do you want to go behind the curtain, or are you all right?
I'm not bothered.
And is it itchy?
You know, the general itchiness, it comes and goes a bit.
Yeah.
There's up the crack there.
Yeah. Is there anything around the front?
Well, it's often a bit itchy underneath.
Yeah. There's not much to see at the front there.
But, it comes and goes, but it's never really gone away.
Sure. So it does look very fungal.
Yeah.
And the Dactacort cream has got some steroid in, which reduces the itch as well. So it's a really good starting point for what you've got. Now, if it's not working, then we can try a different antifungal medicine, and usually that will we'll find something that we can use that works.
Yeah.
And the other thing is to try a slightly stronger steroid just because the area is all a little bit inflamed.
Right.
And I think that will help settle down the itching side of it.
Yeah.
Sometimes you need to use a tablet of antifungal
Yeah.
to make sure that you're getting on top of it, because sometimes it's tricky to treat. And if it's been there for a long time and cream isn't making it better, then that may be the next stage.
Yep. OK, that sounds all right.
Nice to see you.
OK, thanks.
Great, I hope that works.
Yeah, I'll give it a try.
Bye-bye then.
Thank you.
That is a bit down, your oxygen, compared to what I'd expect it to be. Right, I think what we should do is treat this as an asthma attack. I think we should give you 3 things, yeah? I'm going to give you a spacer, you know, like one of those...
Tommy, get down, please, because you'll hurt yourself, good boy.
If I draw a picture, will you colour it in? What's that?
Dinosaur.
A dinosaur? I know I'm rubbish at art, but it's not that bad.
That's
it's
a cat.
OK, you colour it in with that biro, OK?
Tommy, that's a dinosaur.
Oh, that's brilliant. OK, so I'm going to give you a week of steroids, a week of antibiotics. It's OK with the pregnancy. In the meantime, you could also use a bit more of the blue inhaler at a time, which I'll give you. And unfortunately, in pregnancy, fantastic colouring in. Your asthma can get worse. Thank you very much. Now, can you put the lid back on my pen? And are you going to give me your picture? Thank you. And we'll see you again if that doesn't sort it out.
OK, thank you so much.
That's all right. Bye, boys.
Thank you.
Bye now.
Oh, dear. You still got your cough?
Oh, it's terrible. They said will last 6 weeks, so it's only 3.5 weeks so far. So.
Not that you're counting.
No.
Yes, what can I do for you?
My anxiety's through the roof at the moment. I cry for days. I can't go to the toilet, that's another thing. And when I do, it hurts.
Doing a poo all week?
And I keep getting pains under here and around my back. And you know me, I convince myself it's my heart. Oh, I know, I know. I can't help it. I hate being like this, I really do.
I know.
Sorry.
What are the big stresses you've got at the moment? Apart from your physical thing, what's going on?
Apart from Edward just leaving Bristol, nothing really.
And then her other door's leaving as well.
How far are they going? They're just going, one's going to London, one's gone to Dawlish. I don't know, I phoned 111 the other night and this guy chatted to me for like half an hour. He was absolutely fantastic. He managed to calm me down and the pains went. I know I'm probably a waste of time and space and energy, but I just feel... I just want to cry. I don't want to cry. But anxiety is something you can't help. I just can't switch it off and go, oh, it's nothing, and carry on. When I'm sat in a chair crying, I generally feel, you know, this is the end. If I can't get to the toilet, I push so hard that I do get pains under there or in there. So I know it probably is constipation as well. I just feel an idiot now. I'm sat here feeling stupid.
But you've got a problem. But I think your problem's anxiety, really, and fibromyalgia. When you say you're constipated, how many days has that been for?
I couldn't go yesterday. I couldn't go the day before.
Come over here and let me feel your tummy and just have a look at you.
I'm sorry.
OK, so lie yourself back. Do you ever pass any blood or anything?
No.
A little sore there. And over there?
Yeah, that's where I usually get my IBS pain.
OK.
If you find a heartbeat that's not mine, we're in trouble.
So what you've got is very exaggerated bowel sound, so it's going blah, 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 blah in there, you know, it's noisy.
Dr. Roberts said when he diagnosed me with irritable bowel.
Is that what he said? Well, it's the same thing. So I think at the moment...
It's not irritable, it's downright nasty.
Yeah, nasty bowel, but it's not dangerous bowel, and I'm sure it's the same thing. And when you get stressed...
It plays up worse.
It plays up. It's awful. Do you remember over the years what treatments you've had for anxiety? Did you have cognitive behavioural therapy?
I did. I think that was left once.
If you ever want to try CBT again, we can get you sent back, because in the long run, that's probably going to be the most effective. Go home and just think about this being anxiety and
Relax.
And relax. And your children haven't left the planet. They're just doing well and gone
You've got
to
your
London.
grandchildren.
Yeah, yeah. Well, you will get used to it. It just takes a while.
Thank
Okay.
you.
All right,
Thank you.
okay, bye.
Thank you. Bye-bye.
Ronald Trump. So you haven't been up to much in America recently, have you?
No. I phoned the 111 people and they scared the hell out of me by saying, "You've got an hour to get to hospital." I was like,
I think by that what they probably meant was your appointment's in an hour, so you've got an hour to get.
And it looks a little bit snotty.
Say, no, I don't.
I have a migraine.
Migraine. I don't know what you call them.
I don't even know how it's spelled, so I'll just leave it there.
Did you see any boats on the canal?
On the canal?
Yeah.
What
the
canal?
canal?
Oh,
Hi, what are we talking about?
Right. Basically what it is, I'm finding my ankles in particular really difficult to deal with, especially my right leg. I don't know what this stuff is on my skin, but it seems to be pain, swelling.
How long's it been swollen like that for, then?
The last few months.
Is it in the ankle or is it in the leg?
It's right in the ankle.
Yeah, let's have a look at the other one.
Now, the other one is...
So what happened to this leg, then?
Oh, this... Oh, God. I had polio when I was a baby. I was one of the last ones to actually get it. And, caused paralysis from my knee downwards into my foot. And this is necrotizing fasciitis. Started off with a stinging in my knee.
Yeah.
Then after about 10 minutes, I started shaking and perspiring.
Yeah.
I read up on it, and there's a certain type of house spider which carries a bug.
So it's left you incredibly disfigured, hasn't it? With all that infection, and then presumably they did an operation on it?
Yeah, they had to take
You were lucky not to lose the leg?
Yeah, layer of skin from my bum.
Yeah.
It's such a nice bum before as well. Whatever.
It's this one that's the problem today?
My foot won't be very clean because...
That's all right, don't worry.
I can't get down.
That's all right, don't worry. This brown skin is called varicose eczema. And that's because of the varicose veins, the fluid leaks out, and that brings with it some iron. So some of the veins then leak, and the iron it gets deposited in the skin, and it can cause usually itching and brown staining, but it doesn't usually cause a lot of pain. Can you make the ankle go round at all?
I've got no movement in my toes whatsoever.
OK. So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore. It's stupid. It just get laughed at.
And you've had the heart done as well, haven't you? And I guess I'm just wanting to listen into that and listening to check your chest as well.
The brain's all right, by the way.
Good.
So far, anyway.
So I think that there are lots of things that are going on here.
Yeah.
One of them is that I think you've got this varicose eczema, and I can give you some steroid cream that will help in case any of this is linked to that rash that you've got.
Yeah.
It wouldn't particularly explain the leg swelling.
No.
And it's also that there may be some arthritis or some damage in the ankle on that side as well. So I'm going to get an X-ray of the ankle and just see what that's doing.
Right, OK.
In terms of the heart, that could be linked as well, because you've had the valve replaced. Sometimes if the heart isn't pumping very well, that might make some fluid collect in the ankles as well. So I'm going to get a blood test to check the heart and the kidneys and the liver, and I'm also going to do a chest X-ray to make sure there's no fluid collecting there. Now, when I listen, there isn't, so that's good news.
That's brilliant, OK.
How's that for a plan?
That's fine. I've given up the cartwheeling. It's just ridiculous, you know. Anyway.
Listen, well, I'm glad that you're keeping in good spirits.
You've got to have a sense of humour, otherwise you just go absolutely...
Well, I think that's definitely true. That's definitely true.
OK, thank you very much. By the way, what's brown that runs around the garden? A fence. All right, see you later. Bye-bye.
I'm Dr. Graham. So how can I help today?
I have had a sore throat since Wednesday, and as of yesterday and today, it is raging.
And have you noticed anything else, like a temperature?
Today I probably feel like I've got a bit of a headache and a little bit hot, but then I've had a boozy weekend, so I don't know if it is that.
OK.
So I can't really differentiate between the two at this minute.
And are you coughing? Much?
Not coughing much, no. But if I have had the odd cough, then it really hurts sort of right in there. I can
bring
really
anything
feel
up
it.
when you cough?
No, I'm not bringing anything up.
OK. And you remind me, do you smoke?
No.
OK. So let's check you over. Take your temperature first. Open up wide. Put your tongue back in, actually. I'm going to put it down a bit just to look at the throat. OK, that all looks fine. You actually don't have any tonsils to see, which is normal for your age.
Right.
OK, so they disappear as you get older because you don't really need them. Just relax your chin down. And it doesn't look too red, and you've definitely not got any pus or anything. Does that feel sore
really,
under
really
here?
sore there,
yeah. OK, so that is sore there, but no glands that I can feel. But that is where your glands are, and they probably are sore there because that's... Do you know what your glands are for?
Not ever really thought about it, to be fair. But...
so they're where you make white cells. So when you've got a sore throat or any infection, you make more white cells, and that makes the gland get bigger. And often it actually hurts quite a lot, in some ways more than the problem that it's trying to fight. So I think that's the main problem. So I think the most likely thing is that this is a viral sore throat, OK? And that unfortunately it will last probably another at least few more days, maybe even another week.
Right.
You've had it since Wednesday, so it's about day 5 now. And they say that it takes sort of 7 to 14 to clear. And at the moment, I think that you will, you're normally quite well and you will probably clear this yourself. It's a kind of annoying problem where, if I get it, it's not much more I can do apart from take painkillers and wait for it to go.
Okay.
And at the moment, there's no evidence that you've got the kind of infection that will get better quicker with antibiotics.
Right, OK.
Does that make sense?
Yeah, no, that's fine. I just wanted to make sure that there wasn't anything, because it's just been getting worse, so that's
sure.
fine. Yeah.
And was there anything else today?
No, that was it. So just plenty of fluids.
Yes.
Right.
Painkillers? Have you tried some painkillers?
I haven't, no, because I just find that sort of stuff doesn't really touch the sides, if I'm honest.
Yeah.
So.
I mean, it's entirely up to you, but lots of other people would take paracetamol or ibuprofen, or even gargling with aspirin. Some people find helpful.
Yeah.
Because it's sort of anti-inflammatory on the actual throat problem.
Okay.
But you don't have to take anything.
Yeah. Okay. All right. No, that's fine.
Great.
Lovely. Thank you.
Is it raining still?
It stopped. Stay that way.
All right then.
Thanks.
Bye.
Where are we going to?
I'm not allowed to wave?
No.
Is it against the practice, the surgery rules? Yeah, OK. I'll remember that for next time. No waving, no smiling, no laughing.
Absolutely, yes.
And only compliment the reception staff.
Absolutely.
How you doing anyway?
Oh, just take it easy.
Right, so I'm Dr. McLaren. Nice to meet you.
Yeah, I've managed to slip in the bath, which aggravated my shoulder. And then I was looking out the window and it cracked. And I couldn't move. I was in so much pain. And today it just feels unbelievably tender.
Did you land on your shoulder? Did you land on your hand?
I kind of landed there.
Okay.
But it wasn't too painful.
And then subsequently, this pain just started abruptly when you were doing nothing, and since then it's been really painful. Have you tried any painkillers? Or...
I did yesterday, aspirin and codeine, but I can't really take codeine at work.
What is work for you?
I'm an apprentice plumber.
OK.
So I need my marbles around me.
OK. Is there anything that you were worried you might have done, or...?
I'm paranoid it's a rotator cuff because it will take ages to heal. Hopefully you're going to tell me that it's something lovely.
OK, like...
Something that will heal in a couple of weeks.
OK. Well, let's take a look at it to start with.
Yep.
Easier for me with you stood up.
Stood up.
Now turn and face me. OK. I want you to bring your arms slowly up. Touch at the top.
I don't want to.
You stop as soon as it's uncomfortable. So at what stage did that become uncomfortable?
When I grunted.
So...
Can I put them down?
Put them down. If you were to do the same forwards...
That's fine.
That's easy. And right the way to the top?
Yeah.
Easy.
Oh, ow, that's
right
new.
At the top.
Yeah.
If you go across there, that looks like it's quite uncomfortable.
It's not nice, but it doesn't hurt anywhere near as much as when my hand was out.
So you mentioned rotator cuff. It's not entirely typical of that, but I'm not going to be able to say with complete certainty that that's not what it is. This is your shoulder. Your rotator cuff is muscles which support the shoulder, which go over the top of the ball of your shoulder, around the front, around the back. The other thing that you have is ligaments and tendons holding the other structures together. You're quite tender around where your shoulder blade joins your clavicle.
Yep.
And really quite tender when you had to do that movement forwards, which is putting stress around this area, which makes me think it's probably a soft tissue injury to this area rather than your rotator cuff.
That's cool.
I think either way, I would expect with avoiding heavy lifting.
Like lifting radiators and...
Yeah, exactly.
OK.
Taking ibuprofen regularly. Things should start to improve, certainly over the next couple of weeks. And if you're not making any progress, come back and see us. OK?
Right. Thank you very much.
Hi, can I help?
I want to make an appointment for Dr. Edge next.
Just the next possible appointment.
Yeah. Is your mum a doctor?
Yeah.
You look so like that.
I know, I hear that a lot.
Lovely.
Hello.
Hiya. I did bring my mum down before to have a little test for dementia, and she passed. She's a bit forgetful. Like, things will come out not quite in a proper sentence, like words would be the wrong way around them.
Yeah.
She can get quite argumentative as well, which I know is another sign. If it is the early stages of dementia, I would like to know if she can possibly start taking the tablet that prevents it from coming.
OK. We're quite a long way off that, OK? We'd have to make a diagnosis first, and there's certain things that we'd have to do, but we certainly talk about it.
Yeah.
We'll talk about that now. Is that all right? How long ago was it that you brought her down and she had the test for which she passed?
About a year,
About a year. OK. Do you think that you've got worse since then?
No, not really.
Do you?
Yeah, but not really bad.
You're living on your own? OK. To get a diagnosis of dementia, we ask lots of questions, but lots of us get a little bit forgetful.
Yeah.
But are you functioning OK? For example, are you managing your own money and your
Everything.
shopping and all that kind of thing? Functioning fine?
Yeah.
So the geriatricians, the elderly experts, would actually say that you need to have both the sort of forgetfulness and all that sort of thing and what we call a functional problems.
Right, OK.
Like not being able to do stuff. OK?
Yeah.
But let me just find the previous...
But he was adamant I was all right. Wasn't he?
Yeah. Yeah, which is good. You think I'm coming down and I want you to have dementia? I don't. I want it to be stopped if you have got it coming.
Health Centre can help you. Oh, sorry, my lovely. Yeah, it's just really busy, I'm afraid.
I'm sitting in there and I've seen it so packed.
Are you running really late? Yeah, I am, sorry. You can come to the duty doctor surgery at 11:30. I'm sorry.
It's 6 weeks on it.
Yeah.
I'll be back in 2 minutes.
What a day it's been. You've been busy? Oh, yeah, manic.
Thank you for waiting. I've had a few urgent things going on.
Yeah, you can't be dealt with.
God, it's only 5:10. I feel like it should be 6:10.
Thank you for waiting.
It's all right. It's busy.
It's always busy.
All right, let's do that same questionnaire again. OK, first thing I'm going to do is I'm going to give you an address. I want you to say it back to me, and then I want you to try and remember it, and I'm going to ask you again in a bit.
To confuse me.
The name and address I'm going to give you is John Brown, 42 West Street, Kensington. Could you repeat that?
John Brown, 42 West Street, Kensington.
OK. Can you tell me the date today?
7th, I believe.
The year?
70.
Excellent. Can you tell me something that's going on in the news at the moment?
All the fighting and shooting and that, you mean?
What do you mean exactly?
Well...
Who's doing it, Mum?
Oh, sorry, ISIS.
OK. All right, that's fine. Can you remember that name and address for me now?
John Brown, West Street, Kensington.
What number?
Oh, I didn't hear a number. Did you give one? I'm sorry. I didn't hear the number.
I didn't hear the number.
The...
OK, you've clearly remembered it. That's fine. All right. She's not going to fail this. OK, now I'm going to ask you a couple of things, all right?
Yeah.
Compare now to a few years ago. Is she having more trouble remembering stuff that happened recently, like the news and stuff?
No, not the news per se, but she might put her glasses down and she can't find them.
Find them, right. Does she forget what you've said to her?
Sometimes, yeah.
OK. Trouble with financial
No.
pain? No, OK. Manages her medicines?
Yeah.
I don't think there's any sign here.
That's fantastic.
OK?
Yeah, that's
All
brilliant.
right.
Yeah.
So now I can cuss
No,
her,
you
can't I?
Yeah, you can tell her.
Keep telling me off now, yeah. No, but it's only because I work with people with dementia. To me, it's like I see little things.
OK, well, let's keep an
on.
eye and you can ask me. But, I mean, so many people get that thing about putting the glasses, you know, I mean...
Easy done, isn't it?
Yeah, no, yeah, but she wasn't like that before, do you know what I mean? It might just be old age.
It's just age.
Yeah.
Yeah, I'm 78
I would rather my mum, you know, got old gracefully rather than ending up...
OK. I'm not going to say anything about that.
Nice to see you after so long, though.
It is nice to see you, yes.
Yeah.
All right. Right, OK.
Thank you.
All right,
Bye.
OK. All right, then, OK. Yeah.
Sorry, my key's on the floor.
Oh, that's no good. No, I won't be testing you for your forgetfulness. All right, OK, bye-bye.
How can I help?
My son is here. I can't find him.
What's his date of birth?
Oh, now you're asking. 17 of the 3rd. 02, I think it is. No, it's 23rd, isn't it?
23rd of March.
His sister's 17th.
OK.
Right, what can I do for you?
Well, I came Friday.
Right.
Because I've been got a blob in my eye.
Yeah.
And I went to the eye hospital and he's told me that I've had a stroke.
Right.
My eye aches and my head aches all the time. And I think it's affected my hearing as well, because I hardly hear anything.
Yeah. So how do you feel about what they said?
Well, I was a little bit shocked.
Yeah.
But he said they're referring me to the stroke clinic.
Right, OK. Have you heard from them yet?
Nothing, no.
No. I'll try and chase that up. We'll have a little look at you and then I'll see if I can get through to the stroke clinic now, because you need some blood tests and a full assessment. How long did the problem with the eye last for?
I've still got it.
You've still got it, yeah. OK. Your blood pressure's good, so that's good. Can I just have a little listen to your heart? OK, sometimes it can be an irregular pulse that can cause a clot to travel around and cause the stroke, but at the moment it's nice and regular. Deep breath and out and hold it there. That's fine, OK. Right, so they'll arrange a CT scan in the stroke clinic, OK, to assess your head. What we want to do is reduce your risk of having this again, OK, and try and work out why you had it this time. Do you smoke at all?
Yeah, but I've cut down since.
OK, how much do you normally smoke?
Well, about 10 or 12.
OK, you need to stop.
Yeah.
Yeah? This is a warning.
Yeah.
And luckily, you're good. Yeah? But it could kill you. Yeah. Or paralyse you, stuck in a bed at a young age.
OK, what can I do for you?
So, just today, I've had this rash kind of appear. It's quite bumpy.
So, any of these tattoos new?
No,
'Cause
these are
sometimes
all...
you get
these
reactions
are all, like,
to tattoos, so...
10 years old.
I agree. It is a little bit lumpy, bumpy skin, isn't it?
And it's just been quite...
But it's interesting because you're lumpy, bumpy in the area of the blue. Actually, let's just look under, getting under this magnification. So, this, I mean, it looks very much like this is some of an allergic response to the ink in the skin, and we do see this from time to time. And usually it's when somebody's had, you know, a new tattoo or something that's caused it to flare up, but that's not the case with you.
No.
In terms of what we do with this, if it's really troubling you, a mild steroid cream will probably settle it down.
That's good. It just puts my mind at rest. And
so you used to work in one of the churches, is that right?
No, I work in Southmead at the Southmead Development Trust, which is a charity.
Going well?
Yeah, very well. I mean, we're trying.
And last time you came here, you did talk to Dr. Wardock about a vasectomy, did you?
Yes, I think we're ready to take that to the next step.
You are ready, or
Yeah,
you're not
we are ready. Having talked about it. So
Okay.
I need to. What is the next step for that?
Well, the next step is one of
book
us
an appointment.
needs to write a letter, actually,
Okay.
basically, and get you seen. You've got 2 kids? Both in good health?
we've got 2, yeah.
Both in good health?
Oh, yeah, absolutely fine, yeah.
Your wife wants to go ahead with this?
Very lively. Yeah, she does. You know, part of the reason is that we've tried pretty much all the other kind of long-term contraception things, and they've all just been, you know, had side effects and just been a bit unpleasant, so...
Richard gave you a leaflet with all the...
He did, yeah, I read that, looked for all that. Yeah, that was
so it's your call. I mean, we don't need to deal with it today, but if you
if we can write the letter...
I can write a letter and get you in the system.
That'd be great.
Fine.
Excellent.
OK, and then the next thing you know is that you'll get a letter with an appointment to
OK.
go
That'd be fantastic.
to have it done.
Yeah.
Take it from there.
Yeah,
OK.
that'd be fantastic.
Looks like Richard's giving you the chat ready.
He has, yeah.
OK, I'll get that done.
Thank you very
much. You sure I'm not pushing you into...
No, absolutely. No, honestly.
I saw that was the last thing. It looked like you'd been left hanging.
No, we talked about it. We thought about it for quite a long time, and then kind of just... I think that might have even been before Christmas.
I'll give you a 2-day cooling off period, OK? I'll write a letter next week if I haven't heard back.
That'd be fantastic.
All right?
OK, great.
OK,
Thank you very much.
Bye.
You all right? Your pain in your head?
Yeah, it's all there.
OK.
In the backs of my eyes.
I'll see if I can get through to the stroke clinic now. Oh, hi, I wonder if you could help me. I've got a patient with me who presented to us on Friday with eye symptoms, loss of central vision, and she was referred to the eye hospital. I mean, she needs to be seen today, really, doesn't she, if she's got ongoing symptoms? So shall I wait to do anything until you ring me back? Right, she's just going to check with the consultant.
I got a pain in this eye, and I'm worried to death I'm going to get another blob.
What's the one thing you can do?
Stop smoking.
Yeah. From now?
Yeah.
Yeah. Because that's the biggest risk.
Yeah. What causes blood clots, Sam?
So, as I said, one of the commonest ones are an irregular pulse. Another one is narrowing of arteries in the neck. That can throw off a little clot, and that can go to the brain as well. So what they'll probably do at some point is arrange a monitor to monitor your pulse over a week or so to check to see if that happens. And also they'll probably scan your neck to check there's no sign of any blockage there as well. OK. And they'll probably arrange a CT scan or an MRI of your head as well.
Yeah.
OK. A stroke is potentially life-threatening, so it's very important to act quickly if anybody's got the symptoms of a stroke. A way of identifying that is by using the word fast. So the F is for the face, if there's any facial drooping. A is for the arms. Can people raise the arms above the head? S is for slurred speech. And T is for time, acting quickly by calling 999. Hello, Amanda Ramshaw. But as she's got ongoing symptoms, I'm concerned, to be honest. Just thought the guidelines say that we need to send people in. But yeah, so the options are we either send you to the emergency department today, or we can arrange for it to be seen in clinic tomorrow by the stroke consultant.
Yeah, I'll go tomorrow.
You'll go tomorrow, is it? OK, all right. Yep, she says she'd rather do that tomorrow. OK, bye-bye. Right, OK. So I'll send this off now. It says all patients should have 300 milligrams of aspirin, OK?
Right.
And you mustn't drive.
Right, OK.
If you don't hear anything by lunchtime tomorrow, let us know.
OK.
All right.
Yeah, thank you very much.
If you want to make an appointment for the smoking clinic, please do.
OK.
All right. OK, good luck.
Thank you.
Bye-bye.
Bye.
Right, my love. Take care. Bye.
Come on, Sue. Hello.
Hiya.
Come on in, come and take a seat. I'm Dr. Ahmed. So, Murath, you had a accident. You were knocked off your bike. Did you go to A&E when that happened?
I went to A&E, and after A&E, we came here.
Yes, you saw Dr. Pelly. You had cocodamol and naproxen given because you've got a dislocated little finger.
This is not the problem while you were down there.
OK, that's all right. I just want to get the background
Yeah.
first as well. And what's happening now with the finger or with the plastics team?
Finger is It's same. I got pain on my shoulders, really pain. And since Sunday, I haven't been eating. So I haven't been eating nothing. That's
You don't get nothing down since Monday.
Yeah, then when I go to toilet, it's just water comes out.
Okay.
And I have really bad pain in my spine in here.
In your lower back?
Since the accident happened, my body changed. I don't know what happened.
How did you come off your bike?
The 26-ton of truck hit me off my bike. I nearly died. I nearly went underneath.
But you didn't hit your stomach or anything like that
last week?
So it was a close thing.
But someone said I might lose my belly button because I was so frightened. Belly button moved.
You listen to too many stories.
Okay.
I talked to my mum back home in Turkey. That's what she said. But yesterday, someone told me if you're puking up, you could have stomach cancer. That makes me more.
Bless you.
Don't. It's an allergic thing.
Oh, right. He's got a small allergy to dust mites, so that does make his breathing bad sometimes.
I'm allergic to penicillin.
Won't give you that.
Plasters, wool. I'm allergic to a lot of...
Wool?
Yeah. What? I don't know, I've got really sensitive skin, so wool makes me come up in a rash. Some shampoos make me just...
It's the ginger gene.
It is.
I'm a closet ginger as well.
Can you be allergic to tea?
I wouldn't have thought that would be a reason.
How are things going with your breathing then? How are you
At the moment, things are good.
Yeah. Did you do the primary rehab then in March, it says here?
I went along to the actual appointment. My blood pressure was so high. I mean, I did warn them that I'd been kicked out of gyms before because of my blood pressure being so high. And it's not that. I had a reaction to the sulfites. I mean, sulfites are the worst to give me.
Right.
And I don't care what anyone says, I am allergic to them. I mean, the alcohol, it's the sodium methoxysulfite in it, which is a confirmed allergy with me. They sterilise the equipment. And that is what I'm reacting to in the alcohol. And they put it in eye drops, ear drops. I mean, it's like I have no access to any pain relief because if I'm in pain, they tell me to take paracetamol, which contains sodium methoxysulfite sulfite. So I have no pain relief, which is why I kick off so much.
So you're only taking the one inhaler then?
Yeah.
So
I can't tolerate the lactose if you have any more than that.
Okay.
Because I'm lactose intolerant.
Yeah, saw that one. But you haven't had to have any oral steroids in the last year?
Well, the last time they gave me steroids, they nearly shut my lungs down. And that's the maize starch in it.
Yeah.
And with the maize starch, when the manufacturers manufacture it, they put sulfite in it.
Right, let's do your blood pressure. (146/82).
Good, it's back down again.
So, I'll get this ready, and you remember how to use this? Blow, but then you keep... Right, when you're ready, a nice big breath. Well done, take a seat a minute. Let me write it all down. Let's have a look. Yeah, so we don't need to change anything. Right, but I will refer you to the primary rehab. So that's our plan. Is that all right?
Yep, that's fine. That's fine by me.
Lovely. And I'll see you hopefully in a year's time.
OK, I'll see you in a year's time. Bye.
Bye.
Someone told me if you're puking up, you could have stomach cancer.
That's made you very worried about it. Okay. So let's check you over. Okay. And do you feel sick in between these vomiting episodes?
Yeah,
as if...
I feel sick.
I know he's quite poorly because he can't even smoke a whole cigarette.
There's always some good thing out of a bad thing. Are you able to just lie down on the couch?
Yeah.
Okay.
There.
There's generally a bit all over, isn't it? Yeah. Okay, come and take a seat. So look, I'm sorry that you had this accident from your bike, but
I think it's separate.
It could have been a lot worse.
Yeah.
This is a separate issue. You're right. I mean, I think you've got a bit of... there's a lot of it going around, actually, this week. There's a viral gastroenteritis or a bug that's causing a bit of sickness, a bit of vomiting, a bit of loose poos. So we can give some tablets to help with the gripey pains and just drink fluids, but I would stop the naproxen. It probably aggravates.
I don't have cancer or nothing.
No. There's no symptoms of any cancer.
Okay.
Okay. If anything gets worse, you know where we are, or changes, but this should settle things.
Well,
I'll keep you there. All right?
Thank you very much.
That's all right. Take care for now.
Thank you. Right, how can I help you?
Can I have some batteries?
Oh, is that what you wanted? I could do that. Easy. One or two hearing aids, Mr. Dunn?
3.
3. And one in the middle.
What can we do for you today?
Well, it's my ears, doctor. For some months now, I've been getting like a buzzing. And a couple of weeks ago, I went all strange. I nearly passed out and I was sick. And then yesterday, the buzzing in my ear was so horrendous, it was awful. It was like it was full up with something, you know, sort of like blocked.
Have you noticed any difficulty in hearing?
I did yesterday. I could hardly hear anything yesterday.
But you're not having difficulty hearing me?
No, no.
And if I lower my voice, you can still hear me? When people get buzzing in the ear, it drives them mad.
Last night it did.
Kept you awake?
Did last night. I went to bed. I find that I've got noise going on in the house all day because then that takes it away. I've got the telly
that's
going.
Very interesting. You've hit on the solution, almost.
Oh, right.
Have you ever been exposed to loud noise? Never worked in a very noisy environment?
Dry cleaners is about as noisy as it gets.
You're not addicted to going to awful loud concerts?
No, nothing
okay.
like that.
All right.
No. A bit old for that now.
Tell me if I hurt you. Well, your ears are as clean as a whistle, I tell you, you don't need them syringing. That isn't the problem, whatever the problem is. Same with that one.
Very good. Tuning fork. Can you hear that? If I put it there, can you hear it?
Yeah.
Good. Same thing. You hear that?
Yeah.
A bit louder there or there?
There.
Good. That's how it should be. What I'm going to do is call out some numbers to you. Just call them back.
Okay.
So if you put a finger in one ear, all right? 62.
62.
32.
32.
Thank you. Other ear. 78.
78.
14.
14.
That's fine. I can't find anything wrong with your ears. But, you know, you don't get the buzzing for no reason whatsoever.
No.
If things change, then we should see you again and do something about it.
You've disappointed my children now, you know that, don't you?
Because?
They think I'm all gone deaf.
How do they know? How do they know? We've proved you're not going deaf.
Oh, Mum's going deaf. They
don't want you to... Well, they don't want to get you to age before your time, all right?
Right. Oh. Thank you very much, Doctor.
Good.
Nice
Bye-bye.
to meet you. Bye.
Nice to see you. You gonna give me a wave? See you later. Goodbye.
All right,
Cheers
thank
then.
you.
Bye.
Right, that's lovely.
Very good.
Thank
Nice
you.
to see you, Tracy.
Okay.
See you in 2 years.
Yeah,
Or
probably.
sooner.
Yeah. Bye-bye.
Take care for now.
Thank you very much.
That's all right.
Have a nice evening.
Thanks. Bye-bye.
Bye-bye.
Good morning, Corporate Health Centre. Sally speaking.
They are gross, aren't they? I've not seen one like that before. And I've looked at a lot of gross tonsils.
So what I think we need to do is ask the hospital to see you just to check there's no sign of a clot on the lungs.
We haven't really had a working toilet for a while.
How have you survived without a toilet?
Just buckets.
You mentioned that you were feeling really bad yesterday and you got to a stage of worrying about whether you wanted to kill yourself.
Well, I've tried it before.
You've tried it before?
Speaking, how can I help?
Come on in. Hiya.
Yeah, hi.
So what's been going on then?
I just, last couple of weeks, I just get really bad headaches.
Oh dear.
And this morning I woke up with a really bad one.
Right.
This morning.
And what's been causing them, do you think?
I don't know, but I'm on tablets for...
He's got ADHD and he's on concerto, which is on quite a high dose.
Right.
But at the moment, it's hurting his eyes as well, and underneath his eyes and all down here.
Right. Whereabouts in your head are they?
Just like, just all over.
All over. And,
yeah.
And it's been there for 2 weeks on and off, or is it there all the time, or what's it
Like,
like?
sometimes at school, like, if I'm reading or I'm looking at the board, like, for a lesson,
Yeah.
it hurts. Or, like, sometimes before football, if I'm hot, or I get them, like, randomly sometimes.
Okay,
Like,
so when it's hot, it's worse. When you're reading, it's worse.
yes.
It's been on and off in the last 2
Yeah.
weeks, and before that?
You've had them for a while. I've had them for a while, since I've been on my tablets, but I don't know if it's my tablets or not.
How long have you been on your tablets?
A couple of years.
Oh, I see. So you've actually had headache for a couple of years
Yeah.
linked to the tablets. It's just it's been worse in the last.
It's worse, but the last fortnight has been really complaining a lot.
Right then. So you're going to Nepal, is that
Yeah.
correct? Yeah. Okay, and going for 2 weeks.
Yeah.
Volunteering, yeah. And what exactly are you going to be doing?
I'm renovating a school.
Oh, okay,
Yeah.
fantastic. So you said already that you need your tetanus and typhoid. Also hepatitis A. You need to be careful. So we'll quickly have a look through. It might be easy if you come round
Okay.
a little bit. So the hepatitis A is spread through food and water and shellfish, you
yeah.
see, and person-to-person contact. And then typhoid, food and drink again, tends to be food and drink and hygiene, personal hygiene.
Mhm.
And rabies, obviously. Any stray animals resist the urge to stroke
Yeah.
them. Even if you get a scratch or a bite, do go and get checked immediately. Make sure you're okay. You happy to have your injections today?
Yeah.
Allergic to anything?
No.
No chance of being pregnant?
No.
Not breastfeeding?
No.
Lovely. Okay, we've checked all our safety questions.
Yeah.
I just need to take your coat off so I can put it in your arm. If you've got any queries or your things change, you can look on a website called Fit for Travel. It's like the sister site of what we looked at.
Okay.
So it's got the same maps and everything on there.
Okay,
All right.
cool.
So this is the hepatitis A, okay? Sharp scratch. There we go. Right, sharp scratch. Right, then that's your typhoid.
Mhm.
Make sure you're not bleeding. Right, come around the other side, and this will be the triple one. So, sharp scratch. All done.
Have you got any other symptoms going on?
No.
No weakness or numbness? Your arms and legs are working normally?
They're a bit achy today because I played football yesterday.
He was in a tournament yesterday,
Oh, all right.
so
Did
he
you
played
win?
football all day.
Oh, no. We lost
Oh.
in the quarterfinals.
Oh, that's a shame. Never mind. Put your arms out like that. Close your eyes. Squeeze my fingers. Pull me towards you. That's it. Well done. Push me away now. You can open your eyes now. Push, 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 push. That's great. Have a seat. I want you to follow my finger. Just no double vision at all.
No.
That's good. Can you feel me touching you here?
Yeah.
All feels normal. Open your eyes really wide. Close them really tight. Show me your teeth. Blow your cheeks out. Give me a cough. Shrug your shoulders. Stick your tongue out. That's right. I'm just checking all the nerves to make sure they're all working okay. Right. I'm just going to shine this light in your eyes. Lovely. That all looks nice and normal. You said your vision's okay?
I can't read, like, so far, like, I can't.
Oh, I see. So it is a bit blurry on far vision.
We put it first down to the medication.
Yeah, well, of course, those tablets might be the culprit, mightn't they?
Yeah.
OK, well, I think I want you to have an eye test. And I want to reassure you that examining you, it's all completely normal.
Yeah.
So I don't think that there's anything more serious going on underlying all of this. I think probably it will be that the eyes are the culprit and that's the trigger. Have you got any painkillers? Have you tried anything to help?
Painkillers help.
We take paracetamol, it's usually I give him.
Okay. Because it may be worth trying some ibuprofen on top and we'll just see what that's doing. And then I'm going to get you back in to see Dr. Bolam next week.
Okay.
But if things get worse, then we'll see you again.
Okay, well, I'll go and book his eye test now. Thank you ever so much. What did you say, Logan?
Thank you.
Good boy, bye.
Melissa Sargent. Hello, hi there, come on in.
How are you?
Very good, thanks. Come and have a seat here if that's all right. It's a little bit sort of crammed. Is that all right? What can I do for you?
So basically, I have a IUD inserted. It's been in for about 2 years, but I've been getting really bad cramps and pain when I'm having like sex. I can feel it in the top of my cervix, and my period's been ongoing for about 2 months now. So it was about a week ago that I started feeling pain there.
Okay. What I wonder is, has it moved?
Yeah.
Has it come down a bit? Do you feel like it might have done? Is that what you had in mind? Anyway?
Yeah, because I'm not sure what else could I'm normally really regular with my period.
So what I'm going to do is see if it's sitting down in the neck of the womb.
Okay, sure.
Not terribly pleasant, but it's not terrible. So I'm going to get you over lying on here, and you're going to need to take all your bottom things off, I'm afraid. But it's warm today, so that's not
it's
not a freezing day. So what I've got is the speculum, you know that
thing they used
we
to put it in,
and and I've also got some swabs because sometimes funny bleeding can be caused by an infection.
Yeah, okay.
So I'll just check you for chlamydia whilst we're about it. Yeah. And if there's any discharge, I'll take this swab as well. So it's a couple of swabs. Oh, so bend your knees up for me. Is that all right? First thing I'm going to do is I'm just going to feel the womb and see how everything is in there.
Are you sexually active at the moment? No. Okay.
Have you got a regular partner?
Okay. Have you noticed any itching, soreness, discharge down below?
Just use condoms all the way.
Are you sexually active at the moment?
Rarely.
As much as you get a chance
yes,
to.
Exactly.
Just relax a bit there, take some deep breaths. That's great, well done. That's all. Okay. How's that? Yeah, sorry. You can get up and... You're all right?
Yeah.
Very good. If you like to get up and get dressed... So, two possibilities, well, three actually, I suppose, that we have to think about.
Okay.
One is that you got pregnant. I don't think this is likely to be the case with the coil in, and it's causing funny bleeding. So I think we should do a pregnancy test.
Okay.
The next is that the coil has slipped.
Yeah.
And that actually we'll have to take it out. And then the third is that you've picked up an infection of some sort that's causing it all to be sore.
Okay.
The question is really, are you sexually active?
Yeah.
Because if you are, and not using condoms, that is always a possibility.
I've had the same boyfriend for, like, more than a year now.
Yeah, so it's very unlikely.
Yeah.
The coil's a good option for Melissa because once it's fitted, it's sitting there doing its work without Melissa having to do anything about it. And this makes it much safer than other sorts of contraception, such as the pill that you have to remember to take every day because however good you are at that, sometimes you're going to forget. The coil might not be for everyone. For example, if you have more than one sexual partner, you will be exposed to sexually transmitted diseases, and the coil can transmit those diseases up inside the uterus and into the tubes and increase your risks at a later date of infertility or of pelvic inflammatory disease. And then we're going to need to see you again in a couple of days' time, probably. Is that all right?
Yeah, no, of course.
Callum Chick, please. Hi, Callum.
Hi.
Yes, obviously I've seen you before, so I sort of scooped you out there because I know a bit about what's going on. Well, we're not really getting on top of this, are we?
No.
When did this start? How long ago did this all start now? It's been going on
probably about 3 weeks.
Yeah.
Maybe.
And you had a definite water infection at one point, didn't you?
Mm.
Yeah? And you had the right antibiotics and you took the full course?
Yeah. My mum says she thinks it might be a kidney stone.
2 thoughts about that, OK? The one is you definitely did have a urine infection 2 weeks ago. You had bacteria in your urine, which isn't a stone, OK? A kidney stone tends to just give you blood in your urine. I have got blood in your urine, but you've also got white blood cells and you did have bugs, bacteria, OK? So the question for now is whether we treat you with antibiotics, whether you start them now or whether you want to wait and see what your symptoms do and wait for the result.
I could wait till Monday, just maybe take paracetamol.
I mean, I could give you the prescription in case it gets really bad over the weekend, but you don't take them unless it gets really bad.
I think that might be better.
I think what we might do, get you to have a scan of your kidneys, just to make sure that there's no underlying problem causing you to get recurrent infection.
We haven't really had a working toilet for a while, like a month.
You haven't had a working toilet? Have you survived without a toilet?
Just buckets.
Buckets?
Yeah, just have to get the water and flush it.
Oh, I see. Oh, I see. So you're peeing and pooing in the toilet?
We only just got it fixed like a couple of days ago.
That's all right.
No, so it's not unsanitary.
No, that's not unsanitary. No, that's all right. That's OK. It's only the flush that's not well. I thought you were going in the garden or something.
No.
I know. OK, so just keep that and don't use it unless your symptoms get worse. Yeah?
Thank you.
OK. All right, any questions you want to ask me?
Just maybe cutting on my drinking. How would I cut down on my drinking?
Do you want to come back down and sit down for a minute? How much are you drinking?
I drink a lot, but I'm not drinking like 2 bottles of wine a night or something. It's just like, the most I think is probably about 24, but that was about over like 4 days, 5 days. So.
24 what?
Pints.
Pints of what?
Beer.
Pints of beer. So you drink beer, that's pretty much all you drink. You don't drink wine or spirits?
No, like, if I go out in town or whatever, I will, but I hardly go into town. It's just to the pub.
OK. So in a typical week, how many nights do you go to the pub?
I go on Wednesday, I'm going out tonight, and then probably end up going maybe Saturday or Sunday.
So sort of 3 or 4 nights a week in the pub?
Yeah.
Is that right?
Yeah.
And how many pints?
2 or 3.
2 or 3 pints?
On a...
3 or 4 times a week?
Yeah.
Healthy drinking is a really important part of our social fabric, and people need to enjoy alcohol, but enjoy it responsibly. If a teenager gets into the habit of drinking heavily, if they continue this into their older adulthood, this will lead to problems with their general health. So people need to think about their drinking habits and try and establish good drinking habits from early on. So that's 6 units. 6 also, so that's 24. So you are drinking more than the recommended amount at your basic, OK? Is it causing you any problems? Do you feel terrible in the mornings? Do you feel guilty about it? No violence between you and your girlfriend or anything like that? Do you think it's a problem?
Now I am, but before I didn't.
If you're recognising it as a problem, it's from what I'm hearing from you, you can cut down. It's not out of control. You have some nights off. You have several nights off a week.
I can cut down. It's just like things like parties and going to see my granddad.
Why don't you try and go to the pub slightly often? Why don't you talk to your granddad about him having something else in that isn't beer?
Yeah.
You could go to your granddad and have a cup of tea. Sort of strategies like that, isn't it? Or just having shandies, or is that too?
No, I can drink shandies.
Yeah. Well, if you drink shandies, you halve your intake.
Okay.
All right?
I could do that.
Is that all right?
Yeah, that's
okay.
fine.
You come back and talk to me again if you want to.
Okay.
Or Dr. Graham. Okay? Is that okay? There is services that we can offer to help you, but I'm not sure you need that right now.
Okay.
Okay?
Yeah.
Is that okay with you?
Yeah.
Yeah.
Okay, thank you.
All right.
Good morning.
I've got an appointment at 10 to you.
Okay. Who are you seeing?
I don't know. My mum made the appointment.
Okay. Is it a doctor or a nurse, do you know?
I think a doctor.
Doctor. And your name is?
Francesca Clark.
Okay, let's have a look. Yeah, it's the duty doctor, Dr. McLaren. Okay. Yeah, I've booked you in, so if you take a seat, I'll call you in.
Come in, have a seat.
Thank you.
What's been happening?
So I was just taking a drink and I felt it was like a bit weird when I swallowed.
Today?
No, this was a few days ago, but I only managed to get here today because I had to go down to Plymouth to take an exam.
Okay.
But it's just really swollen.
Okay.
And gross.
So
So 3 days ago, sore throat, swollen.
Yeah.
And gross.
Yeah.
Okay. How do you feel? Do you feel today? Do you feel like you got fever at all?
I don't think I have a fever. I just.
Are these from this summer?
No, they're from last summer. I've been really boring this year.
You and me both. I've not done much. 37.5.
I'm just going to Spain tomorrow or
Oh, yeah?
tonight. Yeah.
Nice.
So the rest of my family are already there.
Okay, head back on that. Oh, yeah. Yeah, they are gross, aren't they? I think you might have a bit of an abscess going on there. It looks like it's possibly. I'm going to get the doctor to come and look at that because I've not seen one like that before. Okay. And I've looked at a lot of gross tonsils. Just going to ask Dr. Cordell to come and have a look.
So I've been documenting it. So that's it, like, last night.
Oh, right,
when it
okay.
started.
Let me try and take a photo again for you.
Yeah.
I'm on pen touch and you've got another one. Especially if you're going away tomorrow. Deep breath in. Yes, you can't really see it very well, but it's this bit here that I'm worried about.
Poking out the back.
Hi, Lizzie. Sorry, I get you've been trying to get hold of me.
That's all right. Okay, I just want you to look at this tonsil because I was just saying, I've looked at a million tonsils and I know what a bad one looks like, but I've not actually ever seen one that looks like this. To me, it looks like it's sort of like burst open or something.
Okie doke.
Doesn't look quite right. The only reason she's here is because she's going on holiday tomorrow to meet her parents in Spain, so that's why she's here.
It does look horrible, doesn't it? So we need to swab that.
Okay.
Okay. You get that appearance with bacterial tonsillitis. You can get that appearance with glandular fever, actually. But
It's a bit swollen there. Not sore, but not too sore.
Yeah, you have got a gland up there, haven't you? And then let's have you...
Deep breath in.
Wait for Lizzie to finish.
You are so good at this. Oh, my
It's
neck.
brilliant, actually.
Oh, I just smell them.
Yeah, it
let's
does.
get with you,
Smells
isn't
great.
it? Yeah, so, of course, penicillin, and then because you have got quite a big gland up here, actually, book an appointment to see us once you're back,
Okay.
and we'll just check that that's going down
Alright.
and your tonsils are looking lovely rather than manky. Okay. Is that all right? Does that
Yeah,
make
that's fine,
sense?
thank
You happy
you.
with that?
Yeah, that's great.
Super. Can I go?
Yeah.
In the middle of a cup of tea when you called me out urgently. So I'm going to return to my cup of tea.
Okay.
Okay, have a good holiday.
Thank you very much. Okay, so I just need to get this signed. So if you have a seat in the waiting room,
Yep.
and I'll pass this back out to you. Have a good holiday.
Thank you.
Bye.
This morning, can I help? Do you know who you're seeing?
Dr. Barnett.
Dr. Barnett. And your name is?
Asley Williams.
It's the 15th of June.
What is it today?
It's the 7th.
Okay.
Or is it the 8th? No, it's the 8th today. The 8th.
So it's the same time, but next week?
Next week, next
Okay.
Thursday.
Cool.
Thank you. We'll see you then.
Come on in. Hi.
Hi.
Who have you brought with you?
My old dear.
All right.
Lovely way to be.
Yeah. Hiya.
Hello.
So what's been going on then?
I just don't feel like myself. I feel like doing some stupid things.
Stupid things?
I feel depressed, sort of thing. Like, I don't feel normal. And it's been affecting everyone in the house. And yeah, I just need help, basically.
Yeah, I'm sure. Tell me a little bit more.
Okay, so I don't know what to say. Like,
It's been going on since you were 15, really, hasn't it?
yeah.
Okay.
Especially with the anger issues.
Yeah. So has anything changed? Has anything brought you down?
I feel like in my house, I'm just not wanted by anyone. I'm just on my own, sort of thing. I'm against, like, everyone's against me. I try to control my anger, as Mum said about like getting some wood and about gardening, get some nails, and just every time you get angry, just beat up the wood with some nails.
Yeah.
But that didn't even work because I get too angry and I black out, and then I just ended up punching it in my fists.
I'm sorry to hear all of this.
I just think about things over and over again.
What sorts of things do you think about?
Mum, like, don't love me. My dad, sisters.
Are they the people that are at home with you? Who's at home? Yes, you're living at home at the moment. Yeah. And are those thoughts about feeling low, are they there all the time, or are they just there at certain points?
It's been there. It's there. Like, I do feel low. Something happened yesterday, and it's just completely, like, I didn't want to be here yesterday. I wanted to kill myself yesterday.
Right.
I didn't, like...
What happened yesterday?
I might just explain it.
It's not for me to explain.
do you get a lot of stress and anxiety?
Yeah.
What sorts of things set that up?
Just school, life.
How do you feel about that?
Just down, just always want to be alone.
Would you like some help?
I'd like to say yeah, but a part of me saying no.
Come on in, come and take a seat. Right. What's on your mind?
I'm really stressed out and I get anxiety a lot because sometimes I just feel like life is always going against me and that everything is going wrong and that I feel powerless because I can't change anything.
What year are you in?
7.
Year 7. And everything okay in your sort of friendship groups and things like that?
Yeah, friendship group's pretty good. It's just my home life, which is kind of, like, weird, I guess. Because I live with my mum and my stepdad and my sister and my autistic little brother, Dexter.
And how do you find him?
He's really nice, but he's quite hard to cope with sometimes because he's so high demanding.
Okay.
And I worry for, like, my mum and other people. And sometimes I feel like with their stress, they sort of don't mean to, but they bring it into the house. And there's people snap at each other.
Yeah. There's been quite a lot of things going on at home.
Really a lot, yeah.
And you've had quite a lot to deal with, haven't you? Because there have been health issues in the family, which is adding to all of this. And that's what I think we need to also explore, is how your response to all of these other issues that have been going on. In terms of when you say that you feel a bit low or a bit anxious, have you self-harmed in any way at all or anything like that?
No. But when I'm really, really upset and feel like I have no one to turn to, I think it's more the thought of disappearing and not being there rather than actually killing myself.
And what's been really great is the way you've told me your symptoms. You're actually very clear in how you're feeling, what you need help with, and what we're all here to do is help support you. So counselling at school would be really helpful because that's somebody who sees you regularly in your environment, you know, on a regular basis. I can see if we can get back into having a few sessions via CAMS, but it's getting increasingly hard to get referrals in. But leave that with me. You might find it helpful to just keep a diary, a journal, and just write down your thoughts. What's made you happy? What's made you sad? And what can you do about it? It just helps to clear the thoughts a bit. Does that make sense?
Yeah.
I'd like to see you back in a couple of weeks and see how that diary's going and how you're feeling.
That's cool. Thank you.
Good. Nice to see you, Archie.
Take
care.
Thank you.
All right. Bye-bye for now.
Okay. I thought that went good.
She's so lovely.
I know.
What happened yesterday?
Yesterday, we had a major row.
I'm sorry that it's upsetting. Would you like a tissue?
Yeah, that's...
So sometimes these things are really difficult to talk about, aren't they?
Yeah.
What, can you tell me more about what happened yesterday? You said that you didn't want to be here and that you were even thinking about harming or killing yourself.
Yeah, it's just that like, I tried talking to people and like people just shout at me and then again anger comes out. And I don't like being angry.
Let's just start at the beginning in terms of the things to be worried about. You mentioned that you were feeling really bad yesterday and you got to a stage of worrying about whether you wanted to harm yourself. You said even kill yourself.
Yeah.
Are they thoughts that you've been having that we need to take seriously, or was that just something that happened yesterday and it's, you know, tell me more about that side of things.
Well, I've tried it before.
You've tried it before?
I've tried overdosing, but obviously I hadn't got I've took so many and I've just eventually got drowsy and just dozed off.
Right.
So I just fell asleep, so I couldn't,
When was that?
Oh, it was a couple of months, a year ago, 2 years ago. Something like that, yeah.
But you didn't talk to anybody about that?
It's the first time I spoke to someone about everything.
And then, do you think that is that at risk of happening again?
If I get too low, then yeah.
If you got to that stage and you were making plans or you were actively wanting to die, then that becomes an emergency that you need to talk to the crisis team for, and there's a special number that you can talk to get hold of the emergency mental health team.
Okay.
I'm right in thinking that that's not what's needed now, though?
It's not got that far.
No.
It's not got to the point where I'm
Sure. Suicide is the biggest killer of people under the age of 35, and men are 3 times more likely to kill themselves. I think for all of us, it's a normal part of being a human being to wonder what we're doing here and to have existentialist ideas that mean that sometimes we wish we weren't. Of course, sometimes those feelings can spill over into being more serious suicidal thoughts. And if they do occur and are more deep-seated and pervasive, then it's really important that people go and see their doctor to start the ball rolling to get the support that they need. The crisis team, as I say, is the first number that I'm going to give you, and that's for if you get to a stage where you get that bad again. And there's also the Samaritans. I don't know if you've heard of them.
Yeah, I have.
They're a professional talking service. So for people who are feeling so alone that they need to talk to somebody, and that's what they're there for, 24 hours a day. Okay, so there's always options of people to talk to.
Yeah.
And as long as you're able to do that, then that is going to make me feel safe about letting you go home at this point. Okay. Is that okay from that emergency side of things? I'm going to give you some information about some counselling services that includes anger management courses and some CBT, which is about looking at new ways of thinking to try and help you move forwards with some of these issues. The most important thing is if you're feeling worried or you feel like you're not being safe, then please do something about it and talk to your mum about it, because obviously she's heard all this stuff and is going to be there to support you with this, and we'll move things forward step by step, all right? Cheers, then.
Thank you very much.
Nice to see you. OK, nice to see you.
Take care.
All right, any problems, you just let us
Chair
know.
back.
That's fine, I'll sort it out in a minute.
Hello, can I help?
I cut my finger last night. I wondered if it's more of a doctor's job or maybe a small hospital job.
Can do stitches here. Do you think it needs stitches?
Actually, I'm not a medical professional. Do you know anything about this?
No, I'm not medically trained either.
No.
I don't do blood, I don't train me.
Okay, I won't get out then.
Do you want to pop into the treatment room? There's a reception in there, so the receptionist in there is probably more able to sort of to see whether you just need it dressed properly or whether you need to go to A&E.
That's great. Can I just walk
Oh,
in?
yeah, just go in, all right?
Come on in, have a seat. How are you doing?
I'm okay, yeah.
All right.
The British Wellbeing Therapy rung me.
Yes.
And said to talk to you about mood stabilisers.
So you saw them, I think since then you've had some one-to-one. Is that right, or you haven't yet?
I'm still on the list for the talking therapy.
Yeah.
But they can only help with the low moods. They can't help with the high moods.
Right. So in general, GPs don't initiate mood stabilisers. You go and see a psychiatrist or a mental health practitioner to have a fuller assessment to see whether there is a diagnosis that would mean that you would benefit from a mood stabiliser. Do you know what kinds of diagnoses they're thinking of?
They didn't really say.
And how much of the time do you think it is the low mood that's the issue?
It's kind of hard because if I'm... It's obviously like really, really low or it's really amazing, and when I get in that really good mood, I feel like I don't need any help at all, and I don't need anything.
Yeah.
But then when I go low, I think, why didn't I accept any help?
And when you feel absolutely fine and, you know, better than fine, can you describe it a bit?
I'm either really irritable. I don't sleep. I feel like I have like 1,000 thoughts in my brain, but they're not like bad thoughts.
Yeah.
They're like really amazing thoughts, and I just feel really good about myself. I'm great, and I want to socialise constantly with people.
Okay.
Because normally I'm quite self-conscious. Like if I'm in a low mood, I'd be really self-conscious, have really low self-esteem.
And how often does that switch?
The low moods last longer, so they can last. They'll last longer than a week, so it'd be like more like 2 weeks. Sometimes I've had it like a month. And then the higher moods can last, I'd say, about 2 weeks as well.
Okay. And have you looked it up and thought about what this might be?
I was thinking maybe bipolar.
Okay. Well, what I suggest we do is I'll write a referral letter to the community mental health team to ask them to do an assessment to see whether they think you have got a diagnosis that would be suitable for you to go on a mood stabiliser, as the Bristol Wellbeing Therapy Service have suggested. And I think whilst you're waiting for that appointment, it would be a good idea for you to write a diary of how your moods are, because it's quite useful, I think, for them to see how much it fluctuates.
Yeah.
Okay?
Yeah.
And you could also write down some of the thoughts you've got, okay?
Okay.
Whether they be low thoughts or high thoughts, yeah? And then that will give them a really good picture when you go to see them, Okay?
Yeah.
You know, it may well be that both you and the Bristol Wellbeing Therapy Service are right and that you would benefit from a mood stabiliser. What are your views about going on a medication?
I've always been really against it, but I think recently when I've been in a low mood, I've sort of been like, it's not a way to live. Like, if I could help myself to just be stable, then I would prefer that.
Yeah, okay. So, so I'll get on with that.
Okay, thank you very much.
That's all right. Bye-bye now.
Bye.
I got an appointment at 4:15.
4:15.
Yeah.
Oh my God, that's actually hilarious.
Right, fall, accidental. Fell off bike yesterday. Large wound on the right above your hip. Right, let's have a look at your back then. So it's your back that she was worried about.
Well, yeah, because it's quite...
Nice little what they call a screech in Bristol.
Yeah.
Have a stand up, come over here for me.
I just didn't know what to do with it because I thought, well, we kept it open yesterday, but then it's
got a bit of grit, a little bit of grit in there, hasn't it? Okay. So we need to put some dressings on that. Yeah. So it's just this one that needs dressing, no others anywhere?
No, just that.
Okay. So what were you doing?
On a bike.
What kind of bike?
BMX. It just broke.
It broke?
Yeah.
Yeah, well, we think, no, it's a genuine...
So you didn't fall off it?
Well, I fell after it.
Yeah, the brake jammed and he went flying over there.
Right, come and have a lie on here for me. Just lie on your left side. Don't worry, I have to do the same. There we go. Right, I'm just going to give it a clean. Lean right over for me. Lean right over, that's it. You all right?
Yeah.
So, tell me why you should wear a helmet.
So I don't hit my head.
Things like this are easy to fix. Broken arms are easy to fix. Broken heads aren't easy to fix. And your head is actually surprisingly delicate. Right, that looks pretty clean now, actually. It's like this magical silicone dressing, and it basically just keeps it moist and stops the air getting to the top area of the damaged skin, so that then the skin heals from underneath upwards.
Help with this.
Yeah, are you able to just pull them down for me slightly? Trying to get this so that it covers the whole thing. This is going to look far more dramatic than it is, isn't it? People will be thinking you've, like, ripped yourself open or something. Right, and then we'll put a waterproof one over that so that you can have a shower. And this bit. Keep an eye on this patch here. So this should stay looking relatively clean. If you start feeling unwell in any way, or it starts feeling hot or anything like that, any signs of infection, come back straight away, don't wait. But otherwise, leave this on for a week, come back, we'll take it off, see how it's doing, and then probably put a new one on again. There you go.
Sure.
Sorted.
Cheers.
Yeah, does it feel all right?
All right. Cheers.
Lovely. Thank you very much.
See you later.
Bye.
Have a good day.
Hi, have a seat. Hi. Right, what can I do for you?
Basically, I flew home this morning from Spain.
Right.
I come in about 12, and all I can remember was I stood up and I completely blacked out, and my mum said I, like, collapsed on the floor, smashed my head on the patio thing, and I don't remember falling. I just remember, like, waking up, like, 2 minutes after, and she was like, am I all right?
Okay. So that was 12 lunchtime today?
That was kind of when, no, it probably would have been more around 2 o'clock that it actually happened.
Okay, and how have you been? You've been in Spain, yeah? And have you been eating and drinking normally?
I ate on the plane.
Yeah.
And I've drank, yeah. So,
yeah. Fine, okay. And have you drunk much alcohol when you've been away?
I drank about 3 nights in the 12 days, not like every day or nothing like
Right, okay. And did you have much last night?
I didn't drink last night.
No, okay. Have you used any drugs or anything? No, okay. Fine. Can we have a little look at you? Is that okay? So I'll just check your temperature. That's okay. Can I pop this on? Well, that's going up. I'll have a little listen to your heart and your chest, if that's okay.
I feel like my heart's beating really fast as well.
Do you? Okay. Just a little feel of your pulse. Okay, it's beating a bit fast, actually. And how long's that been for?
Since I dropped.
Right. Just have a little listen to your heart. Okay. What I'd like to do is get you to stand up, wait a minute, and then repeat your blood pressure with you standing, if that's okay. All right, so if you stand up. Okay, that's okay.
I sit back down now?
Yeah. Okay. Your heart rate is still quite fast. So what I'd like to do is get an ECG, a heart tracing. So if you go and have a seat in the waiting room, I'll ask one of the nurses to do that for me, and then we'll review the ECG and see where we'll go from there.
Really
Please
strict
do
film.
not make or receive phone calls.
Good morning, Crawford Health Centre. Sally speaking. Hello, can I help? Good morning, Crawford Health Centre. Good morning. Right. Cut now. Cut now. I think the phones have gone down. Can you check?
Mike, I'm just in the doctor's surgery.
Because there's loads of pus in it, Pat. It's massive.
I'm going to get called into the doctor's any minute now.
It needs to just get squirted out and that's it.
How long should be back?
Wonderful.
I'm Dr. Jewell. Hello.
Hi, nice to meet you.
What can I do for you?
During December, I had a really bad acne, so doctors prescribed me with a solution, and I've run out, so basically I needed more.
Okay. Did it work? Does it do the trick?
Yeah.
So you're happy with that?
Yeah.
And all you want is for me to re-prescribe
Yeah.
it? Okay. Somebody's looking after your diabetes, and is it well controlled and you're on top of it and
Yeah.
you know what to do? How long have you had that for?
I think since year 9, so around about 2012.
You cope with the restrictions and everything?
Kind of.
You have to live with it. You have to live with it as best you can. So what about the PCOS?
The doctors weren't sure if I was being diagnosed with it or not because they were unclear during my scans, and then they didn't really say much about it after that, so I kind of stopped, so I just assumed that I don't have it.
But unfortunately, they think you have.
Yeah.
Do you understand what it is?
Not really.
No, neither do I.
I kind of have a...
Nobody knows what it is. We know some of the effects of it, but nobody knows quite what the underlying problem is for PCOS. It contributes maybe to you being a bit overweight, which makes the diabetes more troublesome, I guess. And it makes your periods be a bit irregular. Now, we don't mind your periods being irregular and scanty. Do you?
Not really, no.
Good. It's associated with a problem of fertility.
Oh, yeah, I kind of had an idea of that.
So do you have any feelings about that?
Kind of. Well, not now, obviously, but... yeah, I do.
No, but I mean, it might be something that you worry about in the future. There's no way of telling you whether that's one of the effects for you or not. The only way you find out whether you're fertile or not is by trying to conceive. And you're obviously not doing that for the moment. You don't do anything until you either get pregnant. Until you get pregnant, it's great, or until you say, look, I'm struggling to get pregnant. Up till that time, you just let it go. So that was easy. I don't have to do anything to prescribe you some stuff for your face. Is that all right?
Yeah, that was basically it.
Okay, how are you feeling now?
Still the same.
Does it still feel the same? Let's just see what your oxygen levels are as well. Your ECG looks okay. It's a little bit fast, but not as fast as it was. And are you normally quite fit and active? Do you do any sports at all?
No, not really, but I do like weights and that.
Right. I think the most likely cause is a faint, to be honest. Okay. But I would have thought you should have recovered by now, okay, because we're about 4 or 5 hours later. So I'm a little bit concerned because you've had a flight.
I have.
And You feel unwell with it and your heart is racing. OK. So what I think we need to do is ask the hospital to see you just to check there's no sign of a clot in the lungs. I think it's unlikely, but I don't want to miss it. So if you make your way to Ward 31B, they'll assess you further, OK, and just to be absolutely sure there's no clot there.
Right,
OK.
Thank you.
All right.
Thank you.
OK, no problem. Bye-bye.
Right, Oliver, insect bite. Where's that then?
On the side of my leg.
This looks serious. When did this happen?
It happened a couple of days ago.
Right, where were you?
Ooh. I can't remember.
So when did you notice it? When you were at home later?
Yeah, when we got back from Greece.
Ah, you've been on holiday. Can we pop you on that bed there and then I can have a proper look at it? Let's have a look. So is it painful?
Yeah, stings.
So what's all this dry patch around here? Is this just crust from where it's been weeping a bit?
Yeah, probably.
OK, let me get some gloves. It's a bit hard, isn't it? So it doesn't look infected at all. It's quite a nasty reaction. I think we just need to put a good dressing on that and just let it heal. Have you been scratching at it?
I was scratching it a little bit and then I stopped because it started stinging.
Yeah. If you scratch it and break the skin, then you get bacteria in from all underneath your fingers into the skin and you can end up with a nasty swelling all the way up your leg, and that's what we call cellulitis, and then you end up having to have antibiotics for that. Just give it a clean. What you want to keep an eye out for is if it starts spreading really far down, or if you start getting lines tracking up his leg or anything like that. If it starts getting really hot or his leg's actually swollen. Sorry. Have a look at it on Friday yourself. And if it looks pretty much the same, just change the dressing. I'll give you a couple. Just change the dressing, and then either way I would come back on Monday and see the nurses just to get it properly checked. So this is bright yellow, so you might see this coming through the dressing, so don't worry too much. If this does start irritating him for any reason, just take it straight off and just pop the plain dry dressing on. There we go. So you need to keep it clean and dry. So don't go jumping in the bath or in the shower with this, all right? So if you need to have a shower or a bath, you're going to have to do it like that. With your leg out the bath, all right? Some Calpol if it's sore. If it's hot, swollen, painful, outside of that dressing, bring him straight back. Thank you. You're welcome. I'll see you later.
Bye.
Harfield Health Centre, how can I help?
If I go like that,
yeah,
can't hear anything.
OK, well, don't go like that.
You're still working?
Oh, yes.
Are you?
But since I lost my husband, I'm so glad to have the extra company of people to talk to.
Yeah.
Some poor soul's waiting for an operation, needs that table, and I'm taking up the space.
You're as entitled to anyone else, though.
You look from this terribly fit and healthy.
Yeah, I am terribly fit and healthy.
The church is absolutely fine. There's nothing wrong there. It's just me. Some days I'm absolutely fine, and another day I am absolutely wretched.
Many of our patients have been coming here for longer than I have been a GP. In fact, some of them have been coming to the surgery since just after the formation of the NHS itself.
We're all living longer. At 65, a man can expect to live for another 19 years and a woman another 21 years.
There we go, sir.
Right?
Yeah.
This is all modern technology for you.
They'll replace us soon, don't worry. You'll have a little robot before long.
Yeah. No, well, yeah, you won't be there at all. If you
We'll
just
be
have a-
redundant, yeah.
How are things?
Carpal tunnel, sweetheart.
Right.
I can't sleep at nights.
Okay.
I'm getting all through the day as well.
Right.
I saw Dr. Roberts a long time ago. He gave me an injection, a cortisone injection.
Yep.
It's all come back now.
Okay. So how is it affecting you?
I'm dropping things,
Right.
can't pick things up.
Ooh, right.
I go with my daughters one day a week for a meal,
Yeah.
and they got a knife and fork for me, big like, you know.
Yeah.
Can't cut things up like,
Right,
you know.
okay.
I lose all sort of feeling in the
And is
thing.
it both hands?
Both hands.
Yeah. And is it pain?
It's a constant pins and needles all the time.
Right.
All down here. At times I get such a pain in
Yeah.
here, and it goes up my arm as
Yeah.
well. I don't want to chop it off. If I chop him off, I can't chop him off.
And does it go into all the fingers and the thumb,
No,
or just?
no, just this lot here.
Yeah. Let's have a little look. Okay. So any tenderness in the wrist at all?
No, no.
No. No. Okay. And if I bend this back.
No problem. It's probably the ageing process, is it?
God, are you really 92?
I am, sweetheart.
You
yeah.
look fantastic.
Oh, thank you.
I thought, how old are you? In your 70s? Whoa, that's fantastic.
Cherry Arnold, please. I'm usually impressed if people cycle here,
Oh, are you?
but to cycle here through the rain...
Oh, well, it stopped raining. Well, nearly stopped raining.
I was about to be terribly impressed. You should have told me it hadn't stopped
No,
raining.
nearly stopped raining.
What can I do for you?
I've got a sore mark here, and I had treatment for a basal cell carcinoma on my back before, and I want you to have a look at it and see what you think about it.
What's the easiest way?
Yeah.
This here?
Yeah.
Oh, I don't think that's a... I don't think it's anything sinister at all. What it looks like is a fungal infection. How long have you had it? Do you know?
When did the last one? I'm going to say a year or so. But sometimes it's very itchy, which is what happened to the one on my back.
Basal cell carcinomas aren't usually as big as this. They're usually raised, and they're also usually sort of 1.5 centimetres. It just doesn't look right for that.
It doesn't look right. That's okay.
The reason I think it's fungal is it's flat,
Yeah.
but it's a bit pink at the outside and paler in the middle.
Yeah.
And that's how they behave.
Right.
I think the only sensible thing is to give you some cream to put on that.
Yeah.
Which is the right thing, if I'm right. And I think it would probably be sensible for you to come back and be seen by somebody.
Right, okay.
I'd be very surprised if it turned out to be another basal cell. It just doesn't look like it.
No, that's fine. It's just that it's worth checking up on these things.
Oh, yes, sure. You look, from this, terribly fit and healthy.
Yeah, I am terribly fit and healthy. Yeah, no, that's fine.
All right.
Okay, fine, thank you.
And here's, this is something to, come here. For some reason, they calculate a frailty score.
Oh, right, okay.
I think it's because of your age, but for no other reason. I have to answer this question about you.
Right, okay.
This patient is mildly frail. Much worse than that, the patient is severely frail. We'll say you're not particularly frail at all. I'm not allowed to put in...
This is a joke.
Yes. If I'm as healthy as this when I get to this patient's age, I shall be doing terribly well.
Yeah,
Go away.
yeah, no, I'm doing really well. That's fine. Thank
Bye-bye.
you. Bye.
Right, so it sounds like carpal tunnel. When you had those injections before, did it help?
It did help, yeah.
I don't personally inject carpal tunnel, but some of the other doctors do here, so we could ask one of them to do it. Alternatively, we could refer you to the musculoskeletal clinic to consider surgery
Yeah, but at my age, is it worth the surgery?
It depends how much is bothering you. I mean, you seem like a fit 92-year-old, and the fact it's affecting you eating, that's quite significant, isn't it?
Yeah, but if I have that injection,
yeah,
it might last for a few months, like, you know.
It might.
And in a few months, I could keel over, couldn't I? Like, but if I could have got there, and some poor soul's waiting for an operation, and he's at table, and I'm taking up the space.
You're as entitled to anyone else, though.
Well, yeah, but...
But do you want to try the injections?
I feel guilty taking the time.
Oh, you shouldn't do that. Why don't we then ask one of the other doctors to give it a try? But there is the option, OK? And we're not ageist. The other thing we could do in the meantime is add a tablet called amitriptyline, OK? Because this is a nerve problem. It's compressing one of the nerves going through the sheath in the wrist, OK? It would be one at night. They do make you a bit sleepy, but then because the pain is at night, it might help. Yeah, I think it's worth a try.
Please.
OK?
Thank
there
you.
we go. So if you take that to the treatment room and they'll see if they can book that appointment for
Thank you, doctor.
But if it doesn't work, come back to me and we'll refer you to the surgeon.
Oh. Thank you,
I'm not
doctor.
doing that.
Thank you,
OK,
doctor.
bye-bye.
Can I help?
Problem with mine? That's for no man. 10:20.
10:20. Okay. Ah, I know what it is.
You do?
It's next Monday.
Shoot me fool. Old age coming. Thank you.
That's okay.
OK, come and sit down. Right, so how can I help?
Well, I've still got this awful pain and it's just about really getting me down.
Okay.
I've had it, this is going on the 3rd week now. And it's all round here and it keeps me awake at night.
OK.
And it's terrible, it makes me cry.
Oh dear. Right.
I'm in agony with it.
So tell me a bit more about the pain.
The burning pain.
Yeah.
And it's all round here and at the bottom of my back.
And does it feel like it's inside your tummy or is it more on the surface?
Right there and
OK.
on the side.
Oh, right, OK.
But that's the tablets I'm on. That helps a little bit.
I think I need to have a proper look at this again. Is that all right?
Yes, of course it is.
So if you lie down on there, I'm going to have a little feel and you tell me, is that making it worse or is
That's
it...
not too bad on my stomach. Round there, it hurts.
That hurts?
Yeah.
What about if I'm going to push your ribs a little? Is that a bit sore?
That's not too bad, but that is.
That is?
Yeah.
Thank you. And he takes... I'm talking like he's not here.
Sorry.
She looks after me well, my wifey.
I've actually got an orchid which I've kept for our wedding anniversary, isn't it?
Absolutely amazed. You normally kill everything.
You come for the results, is that right?
And you said to come back.
With a witness.
Unless I wear flat shoes, I've got a job to walk.
Why do you wear heels a lot?
My wife won't let me here.
In 3 weeks' time is my golden wedding anniversary and my wife wants me dancing.
Oh, does she really? All right, we better get you sorted there.
Would you mind sitting up? I just want to have a good look at your back.
You're going goody.
Oh. Yeah? Got up too quick, I think.
Yeah.
You OK?
It's my age, I'm getting old.
Right.
I can't wear a bra, see?
Yeah. I'm going to press on your back and I want you to
Okay.
tell me if it hurts.
That hurts.
That was it, was
Yeah.
it? That one?
Yeah.
Further down?
Yeah.
OK. Can you come and sit down? Right. I think this is actually related to your back, having had a look at it. What it says on the X-ray is that one of your vertebrae, right in the bit where it really hurt when I pressed around there, there's a little what they call a tiny wedge fracture. So it means that it's a little bit squashed. And this can happen if your bones are a bit thin, which, you know, unfortunately, as you get older, that often does happen. And then the pain I think you're experiencing is coming from that bone out along your lower ribs. The pain from this sort of thing often goes on for about a month to 2 months. And I know, and it just gradually settles down by itself as the bone gets used to the slightly new shape. It does just get better. Would you like something stronger to take at night time to get you a good night's sleep?
Well, those tablets, they make me sleep, don't they?
Yes, you sleep quite well.
OK.
Yeah, they make me sleep, but I'm nearly out of them now, so...
So let me give you some more of these. All right, I'm sure you'll be feeling a lot better.
Well, I hope so
soon.
anyway.
OK,
All
thank you very
right,
much.
Bye-bye.
Thank you.
My husband would like to make an appointment.
Yeah, what's the problem?
Back.
Oh, back.
Your back, okay.
That Friday
It's
morning.
getting worse.
Friday morning, 10:40.
That's good, isn't it? Yeah, Friday morning.
Hang on, no.
Why?
Bed's coming for you.
Coming in the afternoon, darling.
Oh,
and Philip's home all day, and I'm there. Right, that's super duper,
Take
lovely.
care then.
Right.
Come on,
See
will
you,
you?
lovely. Bye-bye. See ya. Bye-bye.
Come in, Mrs.
Thank
Jones.
you. Right, lovely. Where can I put my bits? Up
Put all your bits on this
there?
bit.
Certainly.
And then sit on this chair for me.
Take them.
And you're here for your lithium blood test. today.
Please. Lovely. Oh, this is all jolly nice.
Now, how are you today?
Pretty well. It's lovely.
Sharp scratch. Your veins gone.
You won't believe it. When I had this done in Southmead, somebody spoke to her as she was doing it, and blood shot all up.
Oh, did you?
Yeah, so maybe she's taken it all.
Ah, they are.
Oh, super, right.
So have you got any plans for today?
Yes, I'm going to the hairdresser's this afternoon, thank goodness. I should be glad to get my hair washed. Back to work tomorrow, then.
What, are you still working?
Oh, yes.
Are you?
lovely. I couldn't stay home. I couldn't.
Wow.
No, I enjoy it.
What do you do?
I work on a refund desk. When people bring everything back, I have to check the receipts and mark it in and give them the money back. They're very good, though. They give away quite a lot when sometimes you think, yeah, they've used this a lot.
So how long have you worked for?
14 years. 7:30 in the morning. Never mind. Gets me out the house. I think that's the main thing, isn't it?
Is it part-time?
Oh, yes, yes. But since I lost my husband, I'm so glad to have the
go
extra
out.
company and people to talk to.
Yeah, that's the thing,
Yes.
isn't it?
So there we are. Let's
All
get
right,
my clothes on. Thank you.
They should be ready about after 11 on Friday.
Oh, right, lovely.
OK.
Thank you very much. Let's pop this away.
All right.
Thank you very much.
Take care.
Right.
Bye now.
Bye-bye.
Right, do you want a long story or the short story?
I want the story I need to be told. And, I want an interesting story.
Yeah, well, it is interesting because I got this condition called myasthenia gravis.
I saw that. Yeah.
Last year, I was at work and I'm speaking the way I'm speaking now. This is not my normal voice. And my eye was closing. And I just thought I had sinuses because of my speech. So I went to see my local pharmacy, and she said, I think we all call an ambulance. You don't look well. Got taken to the hospital. My heart was fine. They eventually got it down to that I had myasthenia gravis.
Myasthenia gravis is an autoimmune condition that affects the receptors and muscles so that the nerve signals that make the muscles contract don't work as well. And what the patients experience is fatigue. Everything's a huge effort. Their eyes don't work so well, they get double vision, and it often affects their speech as well. This is not a terribly common condition. I think this is only the second person I've ever seen with this, and I've been in practice a long time.
So what is happening today?
Basically, I want a ESA form. With my condition now, I can't stand for too long. My peripheral vision has been affected.
How much does it restrict you in terms of what you'd like to do?
Everything. Because I said I got no motivation. And the only way I can describe it to normal people, right, is lazyitis. I don't want to do nothing. I said, because of my speech, people think I'm drunk. So that knocks my confidence, because I said, my job was a CCTV operator and security. And I did that for 14 years, loved every minute of it. And,
but you haven't been able to do it since?
No, but I said, I said, well, get me an alternative.
OK.
But they gave me like a desk job. I can't focus. I get bored.
Stop.
So, I'm sorry. I do waffle. I apologise for that.
Right. But you only want me to do a form for your work?
Yeah, but I said there's nothing else that you can do, Dr. Jewell. I get very isolated now because I said I don't go out.
But you could go out, couldn't you?
No, yeah, that's what I'm saying. But I love my football. I love to go and watch football. And I never missed a game at home. I only seen one game. That's just bringing me down an awful lot.
I think you have to adjust to the state of mind and try and do your best. I mean, I would say, you know, if you want help to make sure you can go to football, go to the club, ask them what they need from us.
Yeah, but again, I do apologise for interrupting. Again, it may seem trivial to you, but I have to go to the club to explain.
Mr. Easter might live for another 20 years or more. And you need to work out what is going to make life worth living.
Exactly.
And do something about it. I agree it's difficult, but it just seems to me that it's important to do the things that will give you a sense of enjoyment. Off you go.
Dr. Dewar,
Nice to meet you.
I appreciate it. Thank you very much indeed. You take care of yourself.
Bye-bye.
Bye, man, now.
Yeah, I'm not supposed to live up your way lately.
I don't know, Hazel. Since I hit 60, it's been downhill, I tell you. I feel like an old crock. Put it this way, the brain doesn't feel like an old crock, it's the body that is.
Have a seat. Right, what can I do for you?
This business on the eye.
The one right in there?
Yes.
Yep.
I've had one that I dealt with about 2 months ago. Well, I didn't deal with it, dealt with itself. It was right here behind the ear.
Right.
And that one morning, all the thing had burst and come out. So this has been growing at a stronger rate lately than before. It's been there for quite a while.
So would you say it's doubled over how many months, how quickly?
I should have thought doubled over about 6 weeks, something like that.
Right, so that's quite significant, isn't it?
Yeah, absolutely.
Is it painful?
No, not at all, no.
And does it affect your vision at all?
Not at the moment.
OK, let me have a closer look. Right, OK. It's about 1 centimetre by 0.6. The way it is at the moment, I think it's a benign growth that's nothing to worry about, OK? Like a wart-like growth, OK? However, the only thing that concerns me about is the rapid growth.
Oh, right.
OK, because that can be a worrying feature. And like you say, where it is...
It's going to, if it does get bigger, it's going to come right into my sight.
Yes, it's a tricky one because for benign skin lesions, there isn't any funding to have them removed.
Oh, right.
Because the NHS, as I'm sure you're aware, has limited amount of funds. So what we need to do is keep an eye on it. Maybe come and see me in another month and I can see how it's changed. OK.
Yes.
As an alternative, if you wanted to have it removed, you could always consider having it removed privately if you wanted to.
Oh, right. Well, it's not causing any bother at the moment, you know, that's the thing.
Yeah. So what I'd suggest, if you don't mind booking an appointment to see me again in about a month, so I can have a look at it again.
Yes, definitely, I'll do that.
OK.
See you in a month.
See you in a month.
Right.
OK, bye-bye.
Thank you.
Angela Maggs, please. Yeah. So it's been about a year since I've seen you, isn't it?
Well, for the first time in a long while, I woke up, it was about 2 weeks ago, and had a terrific nosebleed for nearly an hour.
Oh, dear.
It was like clots and things.
So it
and
stopped in about an hour, did you say?
Yes, and I haven't had them before. So that concerned me a bit.
OK.
The other thing, every so often I have sort of a small light thing dazzles and then a triangle sort of shape of colours, and after about 20 minutes it's gone. I get a bit of a muzzy head afterwards.
Does it matter whether you close your eyes or not?
No, because I've tried to work out which one it is, but there is epilepsy in my family.
Okay, so you're worried it's something like epilepsy?
Yeah. Well, I don't suppose it. I hope not.
I must say, from your description of it, that sounds much more like migraine than anything else. And you can get the visual symptoms of a migraine without the headache.
Yes.
And that's what it sounds like to me.
Angela has been under my care for 10 years, but she very rarely comes to the surgery. In fact, she keeps very good health herself. However, she is the main carer for her husband, who sadly has dementia.
And how are you coping with your husband, is it? How's it going?
He doesn't always realise he's in his own house sort of thing and gets very confused in dressing. But he's been a very good husband and stepfather to my daughter, and the grandsons think the world of him. And if it was in reverse, I'm sure he would look after me.
Do you want to have your flu jab today?
Oh, yeah, if I can, please.
And could you give David a flu jab while he's here? Because we missed it yesterday.
Have you had yours?
Yeah, you gave me mine. I was your first patient.
I'd forgotten that.
You're still alive, so...
Yeah.
Flu injection.
So I'm just going to put this into your tattoo, if that's all right.
I always get a very stiff arm, but this, I'm worse than the children.
Little scratch.
You ready? Little scratch.
Sharp scratch.
Oh, isn't too bad at all.
We did 200 flu jabs at lunchtime yesterday, which is not the most we've ever done, but it did look pretty busy.
Oh, one thing. Hold on. Flu jab.
Oh, yeah. Oh, what a shame. I probably got away with that one.
I want to just have a quick look up your nose. Can you tip your head back slightly? I'll put my glasses on, I'll see better, won't I? OK, sometimes in these situations you can see where the bleeding came from, but I can't in your case. Just want to shine a few lights in your eyes a second. So just look at me, please. OK, can you look at my finger, follow it over here, up here, down here. Do you see double at all when you do that? No. I'm going to look into the back of your eyes. OK, all right. Light's coming on rather bright.
Yeah.
There we go.
Thank you.
So let me just say about the nosebleed first of all. I can't see anything terrible going on up your nose. Your blood pressure is normal. Normally in these situations it's a one-off. So I did a brief examination there. I don't see anything immediately wrong with your eyes. So I think it's migraine. It's nothing to do with epilepsy. OK.
You've been very understanding, and I've taken a lot of your time at
you're
Dr.
taking
Cordell.
exactly 10 minutes, which is what's allocated. That's fine.
Yeah.
OK.
Well, I find you very easy to talk to.
OK. Well, have we covered everything for today?
Yes.
Yeah.
Yes,
Okay.
I'm sure I have.
Do keep in touch with your husband's surgery, though, about the other, other business.
I know it doesn't help, and it makes things worse. But on occasions, usually in the evening, I have bellowed and screamed at him, and I felt if I didn't, I could murder him. He could, and I say, "Oh, I'm sorry, Derek."
Hard, isn't it?
And I said, "I know it's not your fault. You can't help it, and I can help my attitude to you, but it is hard sometimes."
It's extremely stressful, isn't it, looking after someone who's got that sort of problem.
And
I think most people find themselves getting very stressed at times. So,
well, thank you very much for seeing me, Dr.
All right, OK. Now, it's been a year since I last saw you. Do come earlier than this if you need to another time.
Well, thank you very much for seeing me. You're very good.
Bye-bye.
Thank you. Goodbye, then.
What time's the appointment?
Well, I thought it was 4:15, but he reckons it's 3:45.
Oh, right.
Honestly, we're really confused.
All right. And your name is?
I'm Dorothy Nichols. At least I know that a bit of me.
That's good, then. Good start, then.
You have to sit there. Sit that one. That's all right. You can sit there if you like.
I'm not taking over. No, thank you very much.
No problem. We could do it that way round for a change.
Oh, no.
Oh, how are you doing anyway?
Good and bad, good and bad.
Oh, okay.
I'll give you the good first.
Yes, start with the good. I like that.
Blood pressure, that covered quite a period because of the week I was away, and we've improved a good deal.
So ideally we should be sort of 140 or less, but
That's
we're
right.
getting there. OK, so that's the good bit. So
Now, the thing that's not so good, I've been very tired for quite a long time. I blamed the flu, and then I blamed all sorts of things, which I was putting down to age more than anything else
Oh, bless
for a very
you.
long time. Now, Over in Ireland and Knock, I brought you that. You can, when you've got time, you can read it, see
Oh,
where I've
bless
been.
you.
Don't worry about it. It's a little village in the west of Ireland where I worked, where I worked for about 4 years before I came over.
So you went back there
And I was back there for a week, going down the high street, when my doctor, Dr. Murray, he stopped this car and he came
what are you
across
doing
me.
here?
That's right. And he asked me how I was getting on. But I said, I do feel an awful lot of tiredness. He did say, has anyone ever said anything to you about sleep apnea? I said no, but he said it's more common than we sometimes think. And of course, I did a Google, as we all do these days, and there were a couple of things that did then worry me. One was waking up at night. I wake up to go to the bladder troubles once, sometimes twice a night. But sometimes I have woke up panting. The second thing is a very dry mouth, and it's not a thirst. And the third thing is the legs. It isn't pain, it's more or less a jungling of the legs.
OK. Do you know if you snore?
I don't really know.
Because obviously with sleep apnea, the key is that you're snoring, but you're also kind of breath holding or whatever. And we're not going to be able to get that evidence from you of somebody saying, oh, you know, if they're in the same bed with you, they're going to notice that, and they maybe could even time, you know, how long if you were holding your breath. So there's a bit of uncertainty there. There's a score that we could do once we've checked your blood test. There's a score called the Epworth score, which will tell us what the likelihood is. We don't just go by that, but partly it's about the snoring, but it's partly about exactly, do you fall asleep when you're talking to people, or is it just if you're watching a sort of film and it's late at night, then you might fall asleep sort of thing? Or
I should wake up refreshed, he said, irrespective of my age. That's the key.
No, you're right. But the blood pressure I'm pleased with.
Thanks very much, Doctor.
OK, nice to see you, and thank you for your bookmark. I shall keep that in me BNF. Every time I look at a different medication, I'll think of you. OK, cheerio.
Thank you, bye-bye.
Come and have a seat. OK, so your MRI, it shows a lot of changes, as we thought, in the neck. Lots of disc bulging in a number of levels. And there's narrowing in the canal as well.
Yeah, but...
Yeah,
we knew that because that's what's trapping the nerve.
that's right. And lower down on your back. So do you think you're coping with the pain?
Well, most of the time, I get days where I can't do anything.
Yeah.
Because even my hands now,
Yeah.
I get days where every time I pick something up, I drop it.
Any numbness or tingling in the fingers or the hands?
I get tingling in my hands when I pass water.
OK. Not sure why that is.
Normally.
Squeeze my fingers.
I've got strength there.
Yeah, good. Pull me towards you. Good. Push me away. Yep, that's good strength.
Yeah.
Yep, let me just get my hammer. Can I just check your reflexes?
Yeah.
Yeah, just relax. OK. So, I mean, one of the thoughts is, do we need to do anything about it at this point? Have you ever seen anyone about your neck?
Well, I went a few years ago.
Yeah.
And they gave me physio.
Right.
The exercise they was giving me, I was in agony when I with it.
Yeah. I mean, the other alternative is we could refer you to the spinal clinic, see if there's anything they can do about the neck problem.
It depends on what it involves, doesn't it?
Yeah. I mean, we could ask their opinion if you wanted to.
Yeah. I suppose that might be an idea.
Yeah. Should we do that then?
Yeah.
OK.
Another thing is this ear, it keeps going deaf in it. And I did what you told me not to do and put a blood in, and I've never got so much stuff out of my ear.
It doesn't matter, though. It's healthy to have wax in the ear.
You can't hear anything now. I was stone deaf with that ear. If I
We'll
went
put drops in it then, because remember the earbud got stuck in it last time,
Yeah.
and I managed to get it out, but another time it might get stuck and we couldn't get it out.
If I go like that,
Yeah.
can't hear anything.
OK, well, don't go like that. Have we referred you for hearing?
I got hearing aids.
Right, yeah. But you haven't got them in?
No, what I'm on 1-to-1.
Yeah.
I get no problems.
OK.
Is if I'm in company.
Yeah.
And you get a bit of a rabble.
Yeah.
I can't decipher it. So
Okay.
if I got the things
Right, OK.
I'm all right then.
Fine, OK. But please, please, please
Don't,
don't put any earbuds in. OK. All right, so I'll refer you. See you soon. All right, bye-bye.
I got a blockage, lots of hearing in my left ear. I think it's only wax, probably. First time ever, but it always comes. 91 years, not bad, is it?
It's a sit and wait service, though, so there could be quite a wait.
Sorry?
There could be quite a wait.
Okay, yes, that's fair enough. You can see what I'm talking about.
Yeah.
I can hear with this one, but not that one.
John Webber, please.
Oh, yeah.
Come on in, come and take a seat.
Can I take my coat off, you don't mind?
Yes, no, that's not a problem.
Thank you.
Do you want to pop it behind the chair? Is that okay? Or you can hang it up on the other...
There you are.
John, you can put it on the peg if you like.
No, it's all right, it's done.
You're not wearing your designer coat then today? Don't care about that one. OK.
I had to sell that one.
Have you heard from the vascular surgeons at all about the vascular clinic?
No.
No appointment yet?
No.
OK. There's some things that are showing up when you had the Doppler studies or looking at the vessels in the legs.
Yeah.
And that's why I referred you to the vascular surgeons.
Oh, I see, yes.
Who are the specialists who look at the pipe work.
Yeah.
He come in and had his pulses done last Wednesday.
That's right. You saw Sue and your blood pressure's good.
Yeah.
Well, she said it was all down.
No, it's OK, 123. It's a little bit, I mean, how do you feel on it? When you get up, do you feel giddy or anything?
A couple of times I've been like that, you know.
Friday, we were out and I took him home.
It's been happening. It's been happening when we're out somewhere,
He wasn't as bad as when he was taken into hospital, but he was going that way.
Because of the feeling as if you're going to faint and the blood pressure reading, what we're going to do, we reduce the bisoprolol down to 1.25, and I'll just give you some of those.
Oh, I see, yes.
And maybe check the blood pressure again in 2 weeks after being on it.
Oh, yeah.
Right.
Yeah.
Is it all right if I give that to your wife here?
Yes, of course, yeah.
OK.
I don't know whether you'll agree with it or anything. When I get a packet of tablets, I take them out of the case and put them in a bottle. Does that affect them in any way?
Would you prefer if we set up your tablets in a Dosset box?
Whatever that is.
So you get this kind of pack, a blister pack, and it has all your tablets to take at what time, and you just take them and on the days. Would that be easier?
Well, not really, no. I mean, I've done it myself to try and make it easier. I take the tablets out of the containers, in a sense, and put them in a little bottle, you know. So that when I want to take one, all I do is unscrew the bottle, take one out, and gone.
But then we don't know what you're taking when.
Oh, I know. I have them in the mornings, you know. I don't take them any other time.
Night time.
I think if you've got your tablets,
Yes.
it's better to keep them in the packets that they are and take them as you're supposed to. All right?
Yeah.
Good.
Yeah.
Nice to see you both.
Oh,
All right,
lovely.
good.
Oh, there you are.
I'll get you your coat now.
No, don't worry, sweetheart. That's all right.
Thank you.
Margaret Staining.
Come and have a seat.
How are things?
No, not so good. I tried the martesipan, but I'm afraid that knocked me flat out.
Okay.
I was
So didn't get on with it?
No, I was like a zombie. And I thought, I can't be like that.
Yeah, because we've talked a couple of times about how things are really getting you down.
Yeah.
And it seems like that's ongoing.
It is. It's just me. I've got to learn to live with things. And it's very difficult.
Yeah.
It's very difficult.
You mentioned that things were a little bit up in the air with work.
Oh, no, the church is absolutely fine. There's nothing wrong there. It's just me.
Yeah.
It's just me.
Yeah.
And I got to learn to let go. And I'm finding that very, very difficult.
How do you think we could make that easier for you?
What, the letting go?
Yeah.
I don't know. I think that's to do with up here. Some days I'm absolutely fine, and another day I am absolutely wretched. But I know I can't go on much longer. I've got to be honest with you.
Have you done anything that you can think of to injure it?
No, only playing golf. I play 27 holes a week.
So what kind of things do you like to knit?
Cordies.
Yep.
You know, anything. I've knitted all for the grandchildren.
I knit, but very, very slowly.
Am I right in thinking you're a ballroom dancer?
Yes. We could be competition dancers, but it's too expensive.
But as long as you enjoy it and it keeps you
We
fit...
enjoy it, we do, we
yeah,
enjoy it.
Absolutely.
So what have you got planned for the rest of the day?
I watch a lot of television. I got a dog and he likes playing ball.
Aww.
He's always busy. I do the aqua aerobics and he does the walking.
I still put that there swimming twice a week. Mine, I do more talking than...
More talking than swimming.
Brian Lovell, please.
Hi, here we go.
Hello, hello.
Good evening.
Have a seat.
Hi, thank you.
How are things?
Pretty good, I reckon.
I like to hear that.
Yeah, everything seems to be... Well, it just carries on as normal.
Yep. Any problems?
Not that I can think of.
Don't have to try and look for them.
No.
So getting about as normal, going on your holidays?
Exactly. The only thing, I've tended to slow down.
No.
Playing football. Yeah.
Who are you playing football with?
Only the grandchildren.
Yeah.
So it's now got to the stage where Grandad got to play in goal.
Keeps you fit then.
I'm a great-grandfather,
Right.
really.
Yeah.
And the other great-grandfather died a couple of weeks ago.
Oh, I'm sorry to hear that.
And the youngest one, the 8-year-old, I've told him I'm slowing down playing football.
Excuse me, yeah.
Told him because I got a bad leg. So he said, if Grandad gets his leg fixed, you only got 14 years to go and you'll be 100.
Thanks for that.
Yeah. No, what can I say? I just feel that I'm lucky.
Absolutely.
Yeah.
Yeah. So, can I just check your blood pressure? So, any chest pains? No. Breathlessness?
Only if I run too far.
Yeah, well, that's fair enough. Yep, perfect. Right, okay, so just book for a routine blood test when you've got a minute, fit it into your schedule. Fantastic, well, nice to see you.
Yeah.
Keep playing football.
I haven't seen you a long
I know.
long time.
I know.
Anyway, thanks for that.
No problem. You look after yourself.
OK, thank you.
OK.
It can be really hard when you're looking after someone else as well as looking after yourself, and then you also have work responsibilities which are...
I enjoy it.
Yeah.
It's my life. Yeah. That's my solace.
We stopped the mirtazapine. Do you think we should restart the Sulapin then? Because we've stopped prescribing it for you.
Yes and no.
Do you want us to restart it? Because we talked about the potential risks.
This is it, but I don't know what the potential risks are.
When compared to other antidepressants, it is possibly more, puts you at greater risk of heart-related complications. So the options are not being on a medication and thinking about other strategies, talking-based treatments, for example, maybe some counselling, something like that. Trying a third option, a different antidepressant, or going back to it and accepting maybe there's a slightly increased risk.
I don't know. I really don't know. It's all I know is I can't go on the way I'm going on.
Yeah. I guess we have to make a decision, don't we?
Well, what would be the other one you were thinking of?
We could try something called sertraline. Why don't we give that a go?
Stupid I am, really.
There can sometimes be a reluctance amongst older people to talk about their mental health. In the past, there has been a stiff upper lip attitude and the feeling that they were wasting their doctor's time by coming and talking about how they're feeling. My advice is not to suffer in silence, but to come and speak to a doctor about how they're feeling, because there's lots of support which we can offer. Why don't we give that a go? If we're not making headway, then we think about something else.
OK.
If you could perhaps book an appointment in about 3 weeks to catch up again.
OK, thank you very much. Sorry about this.
No.
Bye-bye.
Bye then.
I was up at Tesco's and nuns were outside, so I give them £4 each. She held my hand and said, "Oh, you have a nice day." I thought, oh, she goes backside, and I win €1 tonight.
All right?
Yeah, fine. Here we are.
Come on in then.
And I brought my hat in case you want to put a patch on top of my head. But there you are.
And how are you? How's your head? Oh, it's looking better, isn't it?
Oh, good.
It's drying up.
Good.
Oh, at last.
But it was weeping.
See, all this is lifting off now. It looks nice.
Is it?
Yeah.
Is it skin cancer?
Well, I don't know. What do they tell you?
Well, that's what they said down the BRI about 20 years.
20 years ago?
Yeah.
It was known, you men are known for it, you see, because you haven't got much hair, have you, on the top of your head? So you men should always wear a hat, really.
This is the best one, look, because it covers my ears as well.
Have you always worn a hat?
Only when I was on the buses.
On the buses, yeah. Yeah, I don't wear them anymore, do they?
No, I don't never see them now, do you? Not the inspectors.
No. It's quite dry. I'm quite happy to leave it open.
If you leave it open, that's the best treatment for it.
That's fine by me.
I got to see the cardiac rehabilitation counsellor.
Oh, right.
Sounds good, doesn't it?
Have you seen one before?
Twice I've seen her. She's nice.
Okay. And what do they do?
Trying to get me to find some activity.
Is there anything that you've seen that you'd like to do?
Tai Chi, I did that. That was nice. I made everybody laugh.
I expect you did, knowing you, yeah.
When they said to take like that, and
that reminds you of our Latin American dancing classes. You remember those?
I can remember the square dance.
That's great. Right then, I'm going to see you Thursday then. Oh, it looks lovely.
Oh, dear. Oh, me stick.
your stick.
Don't forget me stick. Thank you, sweetheart.
That's all right. I'll see you Thursday then.
OK, then.
Behave yourself. I love seeing the older patients. They've usually got a story to tell.
Beep, beep.
You're doing very well, actually. The most rewarding thing about treating the older generation is that you learn a great deal by hearing their life stories.
Well, I've been a bit worried about it because it didn't clear, so I'm pleased I've seen you now.
I just recommend that you keep interested and keep curious, maintain friendships, and pass on your wisdom to the next generation.
I intend to grow old disgracefully.
Good morning, Holford Health Centre. Can I help?
When she's asleep, she's breathing really like like that kind of thing.
He needs to go to the hospital. He needs to go to A&E.
He stops breathing for a while and then does a huge gasp.
I'm going to be a doctor.
Well, I hope you have somewhere to sit when you're a doctor.
Treating babies and young children is actually my favourite bit of general practice.
The way they tell their stories can be very entertaining and it brightens up the day.
All parents worry about their children. I'm a parent. We all worry about our children. And I think seeking reassurance and guidance on the fact that we're doing the right thing is helpful to all of us.
Danielle Winter. Hello. Who have we got here?
This is little Harley.
Oh my goodness. Fast asleep and looking happy. Come in. It's a warm day for little one, isn't it? Oh. So, shall we start with you?
Yeah.
So, how did the birth go? Were there any issues or problems
No, the
or
only
anything?
thing, just halfway through, we decided I need to turn around. So it was, I think it's called face presentation,
Okay.
is it?
Oh no,
so that was
to get out then.
Yeah, so that was the only thing, and it took a while. But apart from that, everything else went okay.
Perfect. And in terms of your bowels and waterworks, everything
all of
okay
that's
there?
fine.
No
Yeah, all of
troubles.
that's fine,
And down below,
all fine.
feels all right. You didn't have any stitches or
No,
anything
no
though,
stitches,
so
nothing.
perfect. Well,
Yeah.
you're a natural, obviously. And how are you feeling in yourself? You
Yeah,
look
perfect.
well enough. Are you getting
Yeah.
some sleep?
I'm getting- he
or?
was a bit naughty last night, but apart from that,
Okay. And feeding-wise?
he's feeding a lot.
Feeding-wise he's fine. He's taken to the bottle all right?
Yeah.
Perfect. So any concerns about him?
About, I think it was a couple of days ago, he did a complete solid pill, and it was really long, and it had blood in it. And I was a bit like, oh gosh. 5 minutes later, he just did a normal poo again, and he was completely fine.
Did that coincide with him going onto formula?
No, it coincided with him going on to an anti-reflex formula, and I didn't know if that was anything to do with it.
Probably, yeah, might be the
So I
change of
swapped
milk.
back to the colic and constipation one, and the poo was back to normal.
Yeah.
But,
So can we have a little look at him?
Yeah.
I'm so sorry to wake him up. Oh, look at him. Oh, look.
There we go.
Hello.
Take this out.
He's like, what are you doing to me, Mother? What are you doing? I was fast asleep. There we go. That's
that
perfect.
right?
Yeah, that's fine. Where's your eyes? Let's have a look. Oh, yes, that's brilliant. Oh, I'm sorry. Is that a bit bright, was it? There we go. All right. Shh, 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 shh. Good boy. Hello.
There you go.
Gosh, he's strong.
Yeah, he was holding his head up for about 3 weeks. I was so shocked.
That's fine. Let's check your boy's bits. That does look like you might need to do a wee, so we'll stand back if we need to. Whoop. That's fine, both his testes are down. Let's check your legs. Have you got your red book anyway?
Yes, I do. It's in my bag, in the big bit, yeah.
Wow.
Oh, we don't like that side face, do we?
Oh, I don't blame him. That was a bit mean. So, have you got an appointment for his injections yet?
Yes, I have, yeah.
Fine.
Yeah.
So, are you okay about having those?
Yeah,
Obviously,
that's
none of us
fine.
like to have our
No.
babies jabbed, but they'll explain to you when you come along.
Yeah.
And sometimes they can get a little bit of a temperature or be a bit grumpy,
The health
so you're allowed
visitor
to
last
give.
week.
He's really gorgeous, aren't you, pretty boy? You are. We can say that when you're a baby, not when you're 18. We won't call you
No.
pretty then.
Oh, thank
Take
you very
care.
much.
Yeah. Lovely to meet him. Bye.
Yeah, all right.
Hello.
Hiya.
Hello. Very good, so it is. Are you Cody?
Yeah.
Cody, who's this?
Mummy.
Mummy. Very good.
I brought him in a few months ago because his willy didn't seem to be growing with him.
It doesn't.
No, it doesn't seem to be growing at all.
No, it won't grow until he's about 11.
All right, okay. But he's been complaining it hurts quite a lot.
That's different.
And also his bum is also red raw.
Does he scratch it?
He's always irritating him, yeah. But he's just, for the last 3 days now, he's been complaining that his winky hurts. He calls it his winky.
Cody, what I want to do, please, is to have a look at your bum and your winky. Is that all right?
Yeah.
So now you take your trousers off. All right. OK. Now, well, what I want to do, sweetie, I'm going to put you up on the bed because it's going to be easier for me. Here we go. All right. So first of all, we're going to look at your bum. Oh, he's scratching here and here.
Yeah, it's all around here as
He's
well.
very dry, so actually I'll give you something to put on there.
Okay.
Where does your winky hurt? Can you show me? It's a bit tight.
Okay.
That penis is perfectly all right for size.
Right, okay,
At
yeah.
his age.
Good boy, do you want to get your shoes on?
Careful, careful. Not my... Those are my keys.
Cody, can we get your shoes on?
Sorry.
So that's very nice of you to say sorry. Thank you. Where am I going to sit now?
Nothing.
I was going to give him some steroid for that skin, but actually what I'd like to do is just some moisturiser. It just feels dry.
Yeah.
And if you put some moisturiser, it may just make the itching go away.
Okay, yeah.
I'm going to be a doctor.
Well, I hope you have somewhere to sit when you're a doctor. You can use this as much as you want, so I would put it on 2 or 3 times a day.
OK, lovely. Come on, then. Are you taking your picture? All right, say thank you.
All right. Bye-bye.
All right, thank you. Say bye-bye, then.
Bye-bye.
Bye-bye.
Thank you.
Polly, please. Come on through. And your grandmother?
Yeah.
Yeah?
Yeah.
OK. And Polly's how old now?
Coming up 4 months.
Yeah. And how can I help?
She's worried about her eyes. This eye, she'll open it really, really big and it looks bulbous.
OK.
And you can see all the white right the way round it, and sometimes the eyeball will sort of tremor a little bit.
And how long has Mum noticed this being a problem?
Well, when she was born, she had quite bulbous eyes. Do you know?
OK.
They were quite thin, but they settled down. We put it down to pressure and what have you, but about the last month,
About the
6
last
weeks,
month.
that she thought it was settled, but it haven't, and it's, like, a bit worrying.
He keeps getting the gunk coming in his eyes. He's waking up with his eyes stuck together.
Just picked this little one up from nursery. I think there's conjunctivitis going around.
Yes.
So she's suffering a bit.
In his left eye, it's watering on its own, comparatively swollen and red, kind of.
And it's pus in the morning. Yeah. And is it itchy? Yeah.
And is there anything else that's happening at that time? Is any other limb shaking or anything like that?
Not that I've noticed.
OK, all right. And how's she fed at the moment? Is she bottle fed or breast?
Bottle, yeah.
And she's taking all the bottle feeds?
Oh, yeah, she's a greedy moo.
And nappies are all OK? Is it both the eyes or the right eye?
It tends to be the right eye, but
OK.
the left eye does it, but not very often. It's more the right one, and sometimes it's squint right in.
OK. And is there any family history of any eye problems?
I've got eye problems myself.
Any squints in the family?
Yeah, I had bad squints. I had surgery on them.
OK.
Yeah, she's just generally worried about it.
All right. So let's have a look at Polly. If you pop her out and bring her onto the couch there, I'm just going to wash my hands before checking her. And no vomiting or anything like that?
No, nothing.
OK, so if you pop her up here. And no discharge from the eye?
No, none.
No. No, let's just have a shine a light in here. You're very cute, aren't you? We've got the eyelid on the right just seems a little bit lower compared to the left, and there might be a slight inturning of the right eye. Fine, and apart from that, she's absolutely fine in herself?
Yeah, yeah.
Fine, OK. Pop her up and let's have a look at her while she's sitting in your lap as well. That would be helpful.
Come on, then. Oh, come.
Let's just have a look here. So what I'm going to do is get what's called an orthoptist or somebody at the eye hospital who specialises in checking children's eyes in a bit more detail.
Yeah.
Is that OK? The letter should come through fairly quickly.
Oh, good.
So you've got her all day, have you?
Yeah, Mum's gone to work.
Right.
Gone back to work already.
Take care.
Thank you very much.
Bye-bye.
Thank you, bye-bye.
I gave birth less than 4 days ago.
Fair enough.
You're looking very well, I must say, considering I know what you've gone through. OK, so any hyphens or anything in between Clementine Butler? No?
Just 2 separate surnames. One of them is Butler.
No.
What?
2 separate middle names.
Yes, what I meant.
That's not what you said.
Baby brain, we can allow
Yeah.
baby brain, yeah.
Hi there.
Hi.
OK. I wondered if you wouldn't be coming, because I saw that the little one had been off to hospital. Is
Yeah,
that
on
right?
Monday. Yeah,
Yeah.
he was. Yeah, but I think
He's bounced
it was
back,
just
has he?
precautionary. Yeah, just in case he's little.
Yeah, OK, all right.
Yeah.
So you enjoying being a mum?
Yeah, I think it's quite challenging. Yeah. Just because I obviously don't really know what I'm doing, and I was saying to my husband yesterday, in the day I don't know if I should be doing more for him, because either he's eating, sleeping or crying, wanting to be fed. I don't know if there's anything I should be doing to stimulate him.
What more could you do?
Well, I don't know. There's times where I just think, OK, you're awake now, what should I be doing?
Just, I mean, interact and
Yeah.
do as much. You just grasp those moments and do what you can, really. And then, but, yeah. I mean, the time will come when you've got a little bit more time. But so you went into hospital on Monday.
They just observed him and then they sent us home again. So
OK. Has his breathing gone back to normal? It looks OK to me.
yeah, he's definitely breathing a lot better.
Apart from having been in hospital, do you have any other concerns about him?
Only just about his head, actually.
Yeah?
We've noticed that his ear on one side is further forward than the other. We asked about it at the hospital on Monday and they just said it is because he is leaning on one side more than the other.
OK.
And he's flattened his head.
So they were relaxed about it and said it was...
Yeah, they had a good feel of his skull and said nothing seemed abnormal, but
Yeah.
it said they said it was worth mentioning to you when I saw you.
OK.
today. Yeah.
Right then, hello, mister. How are you? Who's mum?
I'm mum.
Your mum, OK. Do you want to sit on mum's knee? And then, are you Nan?
Nan.
Yeah, OK. Presume so, but you couldn't get that so wrong. OK, right then. And so this is Jonathan. Hello, Jonathan. How old are you? 4. Quite a big boy, aren't you?
Yeah.
That's good. OK, so he's eating and drinking right. He's been to nursery.
No, I didn't take him today.
Right, OK. Who's drawn the pretty pictures around it? OK.
See if we got any bigger.
Right then, let's just turn you round a bit, mate.
Because he seems to be more appearing up.
OK. Are they itchy?
No.
Are you scratching them? No, not at all. God, they look itchy. I want to scratch them.
We haven't touched them
Okay.
at all. It concerns me.
Yeah. They've all got a central punctum. They've got one there. There's one there.
Yeah, they've all
got it.
Yeah.
Yeah. OK. All right. You don't know what it is. Anybody else got it?
No, just him.
OK. New medicines or anything?
No.
OK.
He's took his calpol.
OK. I can't put a name on that. OK. It may be bites. Children do come in and see us with rashes all the time. Most rashes are completely harmless and will just get better by themselves, in fact. And he's quite all right, playing... OK, all right. Of course, every parent worries about the rash that can be caused by meningitis. Meningitis is a rare condition. Each GP would only see 1 or 2 cases in their career. Parents should worry if their child has a rash and the child is not very well. The rash of meningitis is red spots on the skin, and the important difference between meningitis and most other rashes is that the spots do not fade when you press on them. You can stick his top back on and just keep an eye on them, OK? A well child is a well child. It'll probably just disappear by itself, OK? If it doesn't, or he gets worse, you bring him back.
OK, that's fine.
Is that all right?
Yeah, that's
Thank you very much. We won't put anything on. I'm surprised they're not itchy.
Yeah, that's what I said.
You know they don't itch. OK, bye-bye.
Is he smiling?
He'll smile just really randomly, it doesn't look like it's a result of something that we've done. He just seems to smile.
He's 6 weeks and 1 day, so it's a bit...
Yeah.
It's right on the borderline, isn't it?
Yeah.
You happy with his eyesight?
He's definitely tracking us when we move around, and he does look at things that are making noise, but not all of the time.
No.
So I wonder about his eyes.
Do you want to get him out of there?
Yeah.
And I'll have him up on the couch to examine him. So you're absolutely right about the ears. One appears to be further forward than the other. And I'm sure the hospital is right. It's because of this asymmetry of the skull, OK? Which is a common thing. And I imagine that this is just going to settle itself down over the next 2, 3, 4 months, actually. We'll have him back and have another look at that.
Yeah, that'd be good.
It's extraordinarily uncommon that we need to do anything about it. So what we're doing here, this is obviously not a full eye check, but what I'm doing is just checking I can see down to the back of the retina.
Oh, it's okay.
You're a wiggly boy, aren't you?
Oh.
So, eyes are moving, they seem to be moving together.
Yeah.
Pupils are the same size, and there's a clear view down to the back, so we don't think there's anything like a congenital cataract that would be obstructing vision there.
Okay.
Okay.
You find your thumb again.
Hey, Ralphie. Hello.
Doing a fake crying now.
Yes, you are, aren't you? Let's just have a look at your spine. It's a nice mobile spine. OK, lovely. Dress him up. I'm just going to jot a couple of notes down while I remember them.
It's okay. There we go. It's all done.
He's a lovely boy, isn't he?
Yeah. When he's calm.
When he's calm.
Yeah.
It's always nice when they're calm, isn't it? And listen, I should see him again, all right? Need to check that he's smiling properly, which almost certainly will go with following with his eyes as well. Those two things tend to go together. So if you can book an appointment for him to see me in 1 to 2 weeks.
Okay.
All right, Alfie? Time to go.
Your chair. Uh-oh. Uh-oh. Chair time. Let's see how we go. Thank you.
OK, you're all right.
Yeah,
Let me do the jaw, because it's quite heavy.
Thank you very much. See you again.
So you book that appointment on the way out?
Yes, I will
OK,
do. Thank
cheers
you.
then. Bye-bye.
You ready to read it? Okay, here we go.
Little fish.
I don't know, that's why I bought your book to read.
I'm Dr. Graham. How can I help?
We've been on holiday for 2 weeks, and while we was away, she was complaining her ears were hurting.
Yeah.
I had an audiology appointment with her today.
Yeah.
So we went down there, and he said that her right ear is blocked.
Yeah.
And the left ear, it looks like something going on infection-wise.
Right.
And he says that I needed to come and see you.
And do they hurt both ears at the moment?
Which ear hurts, Robin?
That one.
Yeah, the right ear.
Does it hurt if I press here? Does it hurt at the back? The ear canal is quite red and there's a bit of pus in there.
Right, OK.
So she might have had an infection behind the eardrum that's burst.
Right.
And then left some
gunky
stuff in the ear canal. Should we look in the other one? For you to stand up, I think it'll be easier for me to get round it that way.
OK.
And this one, if I press here, does that hurt? And that there? Nope, good. I would actually say that one looks pretty all right.
OK.
She needs to have some antibiotics for that side because that's an infection.
That's the side where she's got mild hearing loss in?
That side?
Yeah.
OK. Is she allergic to anything?
Not that I know of, no.
So we normally give amoxicillin, all right?
OK, yeah.
So this is 1 spoonful 3 times a day for 5 days. She should probably keep the ear dry, maybe for a couple of weeks till it's fully better. Is that all right?
Yeah, that's fine.
Good.
Who do I need to see about speech and language?
We could talk about it now if you want.
Yeah?
Yeah.
She's very still learning to pronounce words.
Yeah.
So she can't say things like her brother's name is Jackson.
Yeah.
She says Jack's done.
Yeah.
So her development in school is perfect.
OK. Does the teacher have concerns
No, they
about
haven't
it at all?
said. No.
So it would be worth talking to them because
Okay.
there's a very wide range of normal and a small problem like this when everything else is fine will sometimes just improve with a bit of practice. But if the school is concerned and thinks that she might benefit from speech and language, then they might want to write a small report, OK, to us. How does that sound?
Yeah, that's
Is that
fine.
all right? Because it
That's
sounds like otherwise she's doing really well. And at her age, it's all right to get quite a few things slightly wrong.
Yeah.
Is that OK? Good.
Right, say bye. Say thank you, Dr. Graham.
Bye.
Bye.
Ezra.
Oh, yeah, sorry.
Come on in, come and take a seat.
Thank you.
I'm Dr. Ahmed. OK, so how can I help today?
Well, basically, he's been sick every morning this week, once in the evening, which was yesterday.
So when did the sickness start?
It's literally been like a week. I've not really took notice because I thought, you know, babies, they are sick, so...
So vomiting started...
Yeah, I'd say roughly about a week, but it has been noticeable because it's not normally his character.
OK. When he's been vomiting, has he been vomiting every morning? Or
Pretty
throughout
much.
the day?
No, it's normally just the mornings.
So it's just once a day, usually?
Yeah, yeah.
Is he taking his sort of solids at the moment?
Yeah, but he refused breakfast the other day, so I had to just leave him. But I've been trying to do little and often.
Any temperatures?
No, not that I've noticed.
Okay.
He has fell a couple of times on his head.
For the past sort of 2 weeks at least, he's had this really chesty cough.
He's literally just had a cold and his cough has turned really, really chesty.
She's got chesty cold, so she's not well, she's not sleeping, she's waking up.
He's been coughing an awful lot.
Okay.
And it's just tiring him out. And this morning he just sounded particularly crackly. It's not got any better.
Coughing at any particular time?
So all throughout the day.
Yeah. And at night?
Yes.
Yeah.
Where's your doggy?
Tia, please.
Yes. Tia. There we go.
Hello.
Hello.
I'm Dr. Jewell.
Dr. Joe. This is Tia. She's got a bit of a funny chest, so I just want to check it out. Really.
Okay.
She's been coughing now for over a week, but we've been away, so that's why I haven't brought her down before.
Where have you been?
Isle of Wight.
Oh, what was it like?
Lovely hot weather. Absolutely lovely, wasn't it?
Apart from coughing, has she been all right?
Yeah, she's had a bit of a runny nose a bit, but when she's asleep, she's breathing really like that kind of thing. And then in the morning as well, she's really trying to catch her breath. But then throughout the day, she's all right like this. But
Active?
Yeah.
Obviously very active. Eating all right?
Yeah.
Playing?
Yeah.
Right, let's... She's got a bit of wheezing on this side. It makes life a little bit difficult. Well, it doesn't really. It suggests what we might do about it. 6, 7, 8, 9, 10. That's okay. We all worry about children because we know they can get ill very quickly. Now, the ones we worry about are the ones who are very floppy or pale or not responsive. If they haven't eaten for a while, they've stopped playing, those sort of things. And although we ask questions about it, it's a kind of judgment you make just the moment you see a child. And you make the judgment almost as soon as the child comes in. Is there asthma in the family?
I have it slightly, and my husband does as well, and my son.
So do you have lots of inhalers and equipment and stuff in the house?
Yes, we do.
And you know how to use them? This
Yes.
is great. This is fantastic news. I'm sure it's not a chest infection. She's much too well for that.
Yeah, that's right then.
I can hear the wheezing. And as you probably know, people who have asthma, it's worse at night often.
Yeah.
Now, you can't diagnose asthma in a child of this age. But she has got some wheezing, and I think a sensible thing is to treat that.
Okay.
And if you're very familiar with inhalers and things, we could do it that way. Are you happy with that?
Yeah, that's fine. Yeah.
Now, do you use spacers?
Yes, I do.
I haven't... There's nothing I need to teach you. It's wonderful. Will she tolerate having the mask over her head?
You never know until you try. Right, can I pop you up? We can go.
Now, you know also, if you're treating somebody with wheezing and they're getting worse, that's an emergency.
Okay.
You know that?
Yes.
Thought you would. You're being very kind to me, and sort of pretending, half pretending you don't really know this stuff. Tell me.
No, I do know.
Here's the critical question.
Yeah.
Had you decided, when you were sitting out there, that what you needed was to go out with this before you even saw me?
No.
You didn't? Oh, well, it's very, very decent of you to say that.
No. Thank you.
Good.
Right,
I hope it does the trick. Good.
Thank you very much.
Bye-bye.
Right, come on. Come on.
It's just on the shelf. There's a train. Yes.
What's this from?
Very important. This patient said, "Where is your train?"
That's so funny.
He has fell a couple of times on his head. I know I'm being a paranoid parent now.
That's
but,
all right.
I obviously Googled and was like, the symptoms.
All right. When did he last hit his head?
Oh, it would probably be a couple of weeks ago. Fell off the bed. It was just straight down onto the bed. It's like sofa level.
That was 2-3 weeks ago, and this kind of vomiting thing's
It's just
not going to be
coincidence, isn't it?
related to
Yeah.
that.
The only other thing I've noticed is, I don't know where, because I'm not a doctor, but this is slightly raised. I know he's had that for a while.
Okay. So you're worried about a collection of all these sort of...
Yeah, because when you go into Google, it's like water in the brain, and I'm like, oh my gosh, what have I done?
Okay. The internet can cause undue stress and concern. It's also a great source of information, but one of the things we try and do is signpost patients and parents to NHS-endorsed websites for appropriate information. Do you want to just pop his things off?
Yeah, I can do it
right
here
down
or-
to nappy level.
Don't mind
Mind
the
the
head,
edge
to be
there.
honest.
Yeah, that's quite a bit actually. Mobile babies and children are always bumping into things, and this is part of exploring the world that they're in. With regards to head injuries, if a child is acting out of character, for example, more sleepy than usual, or vomiting, or just not being their usual selves, I would seek further advice. You know, I think he's fine, actually. If he's eating and drinking, there's no vomiting during the day, his nappies are fine.
Yeah.
I can't quite explain this one-off vomit in the morning, but if it's just a once-a-day vomit in the morning, the rest of the time there's no temperature's fine, so on, I think we'll just wait and see.
Okay.
And in terms of sort of lumps and bumps in the head, I mean, his head looks fine here. That's the shape of his skull, isn't it? And
Yay, just a bumpy head.
he's fine in himself.
But yeah, thanks for seeing us.
No, not a problem. Do you want to... Are you okay doing it there? Yeah. Become expert at doing that.
You are?
No, I said you become expert.
Oh, right, I thought you said you're an expert. I was like, feel free.
That's okay.
Do you mind just-
No, that's all right.
Awkwardly bending his arm.
You've got a
into his
nice red coat there.
All right, we're going now.
Right, now we have objection.
What's this day of you?
Take care.
Bye.
Bye.
Thank
Bye-bye.
you.
Oh, you're normal. Yay!
William. All the way down, yeah?
Here we go, little man.
There we go. Right, quick,
can we come?
Have a seat a minute, and then we'll just have a chat about what he's doing. Right then, so it's his 1 year IMS to do. Yeah. And he's going to have 4 injections, all right? A booster of his hib, but also with the meningitis C, and then the new one, the MMR, so the mumps, measles, and rubella. Okay?
Yeah.
So it's a live vaccine. 24, 48 hours, may get a bit of a temperature, maybe just a bit off, you know?
Yeah.
Not, you can't do anything right, you know? Not allergic to anything that you know of?
No.
Yeah, lovely.
You're going to be a big boy, aren't you?
Yeah, it's going to go in his legs, so 2 in each leg, obviously. Because he's nice, big and strong now. We'll have to keep a hold of him because he's going to get
I've got
really...
2 others, so I've got a 5-year-old and a 4-year-old.
So you know how they get?
Yeah. The eldest was the biggest problem. He screamed every time he had one.
It wasn't me, was it? No, I've only been here 5 years, so it wouldn't have been me.
And then I bought the middle one for his preschool jabs like 6 months ago, whenever it was.
Yeah.
And he sat and he smiled.
Oh, well, there you go.
I think the nurse was quite amused. Ready? Hold Mummy's hand then. Okay?
Yeah. All right, Mum, you ready?
Let me see it. Good boy. Well done. Good boy.
Is that one?
Well done. You're so brave. Okay, well done. Good boy.
Okay.
Well done. I know.
All right. You've got hold. We're going to go Men B now.
Good boy. Well done.
Plaster, plaster, plaster.
Good boy.
Right, turn around, next leg.
Just get it done. Just get it all done. Hey, you're fine. You're fine. You're with Mummy.
All right, ready?
Yeah. Good boy. Good boy. Good boy. 1 second and then we'll all be done.
1 more to go. Doing well, doing well.
1 more second, sweetheart. Good boy. Mummy's got you. Good boy. I know.
All done, all done.
That's it.
well done. Well done. Oh, so sorry.
Good boy. He's fine now.
Is he all right?
Yeah, he's such a happy little man. He's a good boy. Aren't you? You might have earned yourself a biscuit when we get home.
Nice.
Have a cup of tea and a biscuit.
Does he drink tea, does he?
Loves it.
Right, so that's everything written up. And I won't see him until he's 3 years and 4 months. Yeah, I'll get the door for you.
Thank you. Come in there, precious.
All right, well.
Good boy. You going to say ta-ta? Ta-ta.
Bye-bye. Take care. Bye.
Right. Thank you.
Kaimani.
No. Don't do anything.
Hello.
Mommy.
Come on in, have a seat. I'm Dr. Graham.
Please don't do that.
When I was poorly.
Just don't do it. Please don't.
What's the matter, darling? You're not having an injection. See,
No injection.
you're not going to have an injection, okay?
All right. How can I help?
Injections. Come on, he's got ongoing health issues.
Yeah.
He's on methotrexate.
Yes.
Friday will be week 8 of the methotrexate.
Yeah.
2 weeks ago, some of his blood tests came back with bad kidney function. His creatinine levels were 78.
Yeah.
His baseline is 30. So they took us in the test. So anyway, for the past 3 days, he hasn't really eaten. He's very tired and he's not himself at all.
Okay.
So I'm quite
And he's
worried.
on the methotrexate for his skin. Is
Yes.
that right?
I want to go home.
I know.
Darling. You're so brave.
36.7, so that's normal. And I'm just going to listen to your heart to count your heartbeats.
Stethoscope. Molly, there's not going to be any injection, okay? You're not going to have an injection.
I don't want the blood test.
I know you do. If he needs one of those, can you not tell him?
Kimani is on methotrexate, which is a drug that requires regular monitoring to make sure it doesn't damage your kidneys or your liver. So he has to have regular blood tests for that. He has a number of other medical conditions, which means he has to go to hospital very often to see different consultants. This has made him very scared of going to hospital and why he is particularly scared of needles.
I know you don't like blood tests, my darling, I know. Okay, let's test. Sometimes we just have to check them.
I'm just going to count your heartbeats, that's all, okay?
Listen to your heart.
So it goes.
It's a bit cold. You're so brave. You're brave like a superhero. Yeah.
Okay, that's fine.
I don't want to be here.
I think he probably needs to go and get some, you know what's done, because of the other issues, because the tablet he's on can bring down his white count, which makes it more difficult for him to fight infection, so we need to know what that is. But the fact that he keeps wanting to go to sleep, you know, and he's not eating, he's not drinking very much, and yeah, exactly, so all signs that things aren't right.
I don't want to be here.
Please come through.
Hello, hi. Hello.
Hello. What can I do for you today?
Well, it's kind of a follow-up appointment about Louis's heart. He gets a racing heart every now and again. There's no kind of set pattern to it, it just happens. And I was asked to take his pulse when it happened, because we found it was about 80 normally, and it does double. And I've also got another concern. I'm worried about his sleeping. He seems to gasp a lot. Well,
just like that?
Yeah.
Oh, okay.
He stops breathing for a while and then does a huge gasp.
I hold my breath myself.
Yes. You do when you're asleep. I think it worries me more now because I counted how long.
Yeah.
And it was 12 seconds he held his breath one night.
And does he snore a lot at night?
Yes. We call him Darth Vader as well.
That's a pretty good Darth Vader impression. Excellent. All right. And how long have you been worried about his breathing overnight?
Especially worried, probably the last 2 months. He's very fitful in his sleep. He'll toss around and wake up a little bit and go back. And some days he's quite tired.
Bless you.
Yeah.
Do you ever get sleepy at school? You don't fall asleep in lessons or anything along those lines?
I wish.
Oh, really? And have you had any thoughts about what you think might be going on?
Maybe I was worried about sleep apnea. But, I mean, when I was a child, I had a similar thing.
Yeah.
And I think I had an operation when I was little.
So I think that you're probably on the money there, Mum, in terms of what's going on.
Yeah.
I think it's your lymph nodes that you fight infection in your neck. You've also got some in your throat as well.
Yeah.
And sometimes they're a little bit bigger in children than they are in adults. And in general, they get smaller over time.
Right.
As they go into their teenage
Yeah.
years. And in terms of operations and things like that, they only really think about those if they're causing a lot of bother.
Okay.
Should we have a listen to your chest?
Okie dokie. So I'm just going to pop down the top if that's okay, and I want you to take some really big deep breaths through your mouth if that's okay. Well done. So that sounds nice and normal. So I'll just check your pulse rate. Perfect. Now, how big can you open your mouth and how far can you stick out your tongue? Cool, blimey. So you do have quite big tonsils. So, absolutely happy to refer. In terms of examining him today, he examines completely normally, but I do hear exactly what you're saying about his heart rate being very quick during these episodes. So again, I'm going to sort of make a doctor.
What I'm thinking is if he was an adult, we'd do an ECG here.
Yeah.
And I'm not sure whether we'd do an ECG at his age, just because I'm not sure we'd interpret it.
Well, that's the thing, is the difficulty with interpreting, isn't it?
So
Yeah.
I don't know whether... I mean, I'm sure the Children's Hospital offers a means of getting an ECG done.
Yeah, yeah.
And or whether we make a referral for them to just see him. But it does sound like it's happening at rest, which isn't... You know, we do need to ask the question,
Yeah,
why
absolutely.
is that the case?
All right. So, we will write a letter to the powers that be about you snoring. And we will check in. The best thing to do is check out your heart, OK?
All right, then.
Fantastic.
Thanks very much.
No problem, thank you.
Bye-bye.
I know you don't like blood tests, my darling, I know. So is there any way they could do them here? Does it have to be at the Children's Hospital?
I don't want to say.
We won't.
I think he needs to go to the hospital. He needs to go to A&E. Because we need to get on with working out what the matter is, OK? I mean, we can do the urine here, but... No, we used to, but we used to have 2 nurses that were paediatric trained, but we don't anymore. So the under 5s, we don't do even routinely. What you can ring whilst you can go home and get the sample done, put it in a pot, yeah. Ring Dr. Mahon and see what he says, and he may say, "I'll see you this afternoon." I don't know, but I'm not sure how much of the problem is to do with a urine infection or not. All right, I'm going to give you a letter, okay? Which nursery are you at?
What nursery do you go to? I don't know.
Do you like your nursery?
What do you like to play? Nothing. Would you like to play superheroes? Not today. Can I be Thor? Oh, don't you want to play with me? I want to go home. We are. I'm just getting this letter.
Okay, but you may need to go
I guess we
to
probably do need
ED. Yeah. All right.
right now.
Do you want me to put that in your bag? Yep. Oh, you poor little thing. Hey.
So can you get to the doctor?
Okay. There you are.
Good boy. Should we go right home?
That sounds like a good idea.
Let's do that.
Okay.
Thank you.
That's okay. Bye-bye.
You okay?
Yes, thank you.
Oh, right. What we have is, I'm assuming it's this foot. I always forget which foot it is. He stubbed his toe.
Yep.
Basically, he has. It's not that one. It's the other. I knew it. 50-50 chance to get it wrong. Right. So he stubbed it about 2 weeks ago. His toe is really quite.
Yeah. It's a little bit sore, isn't it?
It's definitely not sore today. But
Right.
what I don't like is the fact this doesn't seem to be connected to his nail anymore.
How do you mean?
It's all. Yeah.
This is all red and pussy, isn't it? That's the bit
This
that
is
bothers me.
It's not right.
How long ago did you say it happened?
About 2 weeks.
2 weeks. I think he probably just needs a very short, sharp course of some antibiotics.
Okay.
Just to settle that down.
Yeah, no worries. That's what I thought. As soon as it started
Yeah.
going red, I was like,
Yes.
not
Yeah.
I know, sore toe, I know.
So I'm just going to give him the minimum he needs, which is going to be 2.5 mils 4 times a day. So it's a tiny-ish amount that he's going to need. Not stopping you walking.
That's the problem. Nothing really affects him. He just takes stuff in his stride.
Oh, not the bin, though.
No, can you knock the bin, please?
Not the bin.
See, now he's like, I definitely want to get in the bin.
Yeah.
Right.
OK.
Let's say bye, bye, bye.
Bye.
Thank you.
Off we go, then. OK.
Thank you. Take care.
Bye
Thank
for
you.
now.
There we go, folks.
Thank you.
All right, cheerio.
Bye.
Bye-bye.
OK, bye-bye.
Thank you very much.
Bye.